Good evening, everyone. This is the Gloucester School Committee meeting on Wednesday, February 16th, 2022. This is a special meeting. This is not our regular meeting date. And we have just a few items on the agenda for business, the key one being our face covering policy. So that said, I would like everybody to stand and join me for the salute to the flag. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Consistent with Chapter 20 of the Acts of 2021, this meeting will be conducted by remote participation. The public may not physically attend this meeting, but every effort will be made to allow the public to view and listen to the meeting in real time and participate when necessary. If you're calling in on a phone, you can press *9 to request to speak. If you're watching on a computer or device, there is a raised hand button that you can tap or press to request to speak. Please use either of these options during oral communications to be recognized to speak. So that said, I just want to say we are going to take this agenda, the oral communication portion of this agenda, similar to what we did last week. We're going to get a presentation from the superintendent on the first agenda item, which is the face covering policy. We'll then have opportunities to ask questions so that we can get a lot of information out there in case those pieces of information clear up questions people may have or concerns that get addressed from the presentation, so that that when it's oral communication time, people will have all that information with which to be informed on their comments. We also have with us tonight, in addition to our regular school committee members, we have Mayor Verga, who is joining online. So there he's online. And then the superintendent. And we also have 3 Gloucester High School students, all of the class of 2022 at the table with us. We have Jenna Smith, Nate Oakes, and Nicholas Pooley. So thank you for coming and being here for this.
Thank you for having us.
Okay, turn it over to the superintendent.
Great, thank you, Ms. Clancy. So I'll share my, sharing. Good evening, folks. So one important agenda item for tonight. Let's get this going here. As we remind everyone, as much as we can, every day matters in our schools. And thankfully, because of all the work that our students, our families, our staff, our school leaders, the school committee, many others have done, we continue to safely educate all our students in our schools every day to help maximize their learning, address our students' full needs, and also support our community and family needs. Tonight, as Ms. Clancy just shared, I'll just go over sort of the order of operations. I will give a presentation. I'll give a fair bit of information and data to help support the school committee in making their decision tonight, and their deliberation about the mask and face coverings policy. I'll provide my recommendation to the committee for a revised policy. We'll have discussions and questions from the committee, so a conversation among the folks here at the table and perhaps some of the folks we have here online in terms of the Board of Health and Department of Health. Then we'll allow open communication. That'll be managed by Kathy Clancy, and then a deliberation and possible vote. So that's just where we're headed tonight. Just want to make sure everyone knows the steps. So, but first want to get into our COVID update and share a bit of information about where we are and where things stand. I do want to, before I go much further, I do want to just sort of set the scene here that our schools have been doing incredibly well since COVID started. Last year, this year, and it's been very, very difficult. And we faced many difficult decisions along the way. And I'm really proud and really honored to be to work with this committee, which has done that very, very well, both this committee and the previous committee. They've done it through good deliberation, thoughtfulness, concern, and caring for students and for our staff. I mean, that'll of course continue tonight. At the same time, really also urge folks who speak tonight to also take the caution and care and civility that I know Gloucester to be in terms of the way we communicate, the way we care for each other, and also we can have very strong feelings and opinions, and we can also do that in a way where we don't tear people down, but we support each other. And so I say that because we've made difficult decisions all along the way, and we've done that well. We have considered those well, and not many of them have been very clear in terms of they've been a very wide range of how people have felt and what folks wanted, and we continue to make good decisions even when it hasn't been clear. And they've served our children well. It hasn't been easy for students or staff, and we're hoping it'll continue to get easier as we go into one phase after the next. But again, tonight you'll see that there's a very wide range of concerns and opinions about what to do about face covering. So I'll help folks understand some of that. First, we'll just talk about some of the data. So one of our most reliable forms of data here in terms of knowing where we are with COVID and know where we might be going in the next couple of weeks is our wastewater testing that Gloucester has been doing for a very long time, since summer of 2020, well before most communities in the Commonwealth and beyond were doing it. You'll see that today, or as actually last Friday, we're at a very low rate, sort of the same place we were a year ago, very honestly, in terms of February, and also similar to where you were in sort of before the sort of mid-fall and sort of thing. It continues to go down. It's not quite zero, but it's pretty close to that, and that's really good news. Whenever this starts going up, or actually whenever it's changing, we know that to expect the cases to do the same thing in the next week or 2 weeks. So if it's rising, we expect cases to go up in a week or two. If it continues to decline, we expect cases to continue to go down. So that's good news. As of today, we have 11 total active cases. It's the lowest we've had probably since the middle of November, I think. We'll actually look at that in a moment. There's only one active case among all our staff, so our staff are healthy and COVID-free for the most part, almost entirely. So a very low number. You can see a few schools have 0, and O'Malley and Gloucester High, which are typically the highest, are quite low as well. So that's really good news. And it continues the pattern that we've seen. As I said, we haven't been down at 11 cases in my report since the beginning of November, end of October. So that's really good news. And it's quite a change from where we were just a few weeks ago. So as folks have reported and studies have shown, Omicron has been fast and furious. Thankfully, it's essentially behind us in terms of any increase in cases, and we're down to a very low place right now, which is great news. We have done a number of things to keep us healthy and safe. And when I say we, I mean everybody. I mean students and staff and families. In so many ways, our nurses have been crucial in that in terms of supporting our staff and our students, educating them, helping them know what to do if they have COVID or if they've been near someone with COVID. The vaccine requirement for staff was one of the layers we had to help keep transmission low. We've been required masking, which of course we know reduces transmission in school, physical distancing at lunch and other places. And something that will have to continue is folks staying out of school when they're sick or with symptoms. Staying out of school when you're sick, whether that's with COVID symptoms or flu symptoms or a cold, really helps that person get better faster, but also prevents that person from spreading any whatever illness or sickness they might have. So the result of all that work we've been doing is that our transmission in school has been very, very low. So and we see that by looking at our pool testing or weekly in-school testing that had a 1.1 positivity rate across the whole year, including through Omicron. And then our test and stay, which we have stopped, but we did thousands of tests since the beginning of the year. And these are the folks who were close contacts in school. So if we were going to see transmission, this would be among this group of folks we tested day in, day out for at least 5 days. And that positivity rate was only 2%. So also very, very low. So that's good news. It means what we've been doing has been working. And there's some things we need to continue to do. So vaccinations must remain the highest priority. It is undoubtedly, and it's been proven in so many cases, that's the single most important weapon against COVID, especially in reducing serious illness. We learned from Omicron that vaccination doesn't necessarily prevent you from getting the virus, but it certainly keeps you from getting seriously ill in almost all cases. We will continue to urge students and families to get vaccinated. Of course, that is a family choice, as we know, but we'll help them know where vaccination clinics and booster clinics are. And we're working right now, and I'll show you tonight, we have some in-school vaccination clinics scheduled for COVID in our schools in March. And that is very similar to what the city has been doing for years with flu clinics and helping families have easy access to the flu vaccine. So we'll keep on doing those things. Here are vaccination percentages. These are just students in our schools. You can see this is data from last week, so just a week ago. It's increased by a few points percentage in each place typically. But you can see our elementaries average 49% of vaccination among students. O'Malley is 68. You see a real marker here at seventh grade and above is in the high 60s and 70% and 70, and 12th grade is almost 80%. Below that, sixth grade and below, that's where students have had and families have had access to vaccinations for a much shorter time, only this fall or sooner. And so you see those numbers a little bit lower in the 50% range at elementary. So, but that's increased bit by bit throughout the year. Another number folks have asked about is the combined staff and student vaccination percentage. As I mentioned, we've had a requirement for employees to be vaccinated. So when you combine staff and students, we are a little bit higher across the board. You see the range there, the highest being Gloucester High at 76%, O'Malley being 73%. We'll talk more about that in a moment. Here are booster clinics. Vaccination booster clinics that will be coming. We'll be communicating much more to families next week and just before that for when these will happen at school. These are also open to our staff as well in terms of booster clinics, and so they'll have some time after school as well to get boosters if they need them. But we'll, again, trying to figure out every single way we can support families in getting vaccinated. We've also looked back at data about what has happened after school vacations. We've seen quite a bit of increase in number of cases, so we wanted to look back at the data. So what I'm showing you here, you can see the date. So this is November of 2020, and then the December break of 2020. What's notable here is you see in this first row the cases that were active the week before break among students and staff. What happened the week we came back, and then 2 weeks after we returned. So the blue is from Thanksgiving of 2020, and you'll see, and then the yellow again. What happened when we returned from break, and then what happened within 2 weeks from the return. And in both these examples, the number of cases increased about 150% from before break to 2 weeks after the break. Okay, which is that's a high increase. It's a very high percentage increase. If then we also looked at last February, so a year ago exactly, and it's a little bit different. So the week before break, we had 9 cases. We returned from February break and had 11 cases, and then 2 weeks after return, we had 12 cases. So you see an increase about 33% there, which isn't small, but not to the extent we saw the increase in Thanksgiving and like November and December in those breaks. Now, if folks remember, things were very different a year ago at this break. There were travel restrictions, people weren't traveling, that sort of thing. So that may be one of the ways that we reduced transmission. The other thing is there are not as much family gatherings as there are over the holidays, obviously. It is also interesting to note that, so that's the February data here. I think what's also interesting to note is that we have exactly the same number of cases essentially as we had a year ago. But we have many, many more tools in order to combat those. And we'll talk about that more in a little bit. But it's just, coincidental, I believe, that the cases are so similar to what we were a year ago. Looking at this most recent Thanksgiving and December breaks, there was a whole other dynamic. You saw cases starting to increase at around Thanksgiving from sort of the teens. And then Omicron hit and arrived and hit us pretty hard. And you see really Omicron got to Gloucester in the beginning of December, and then it rapidly accelerated, as it turns out it did in many, many places. and then it has fallen off as well. So, I'm sorry, this should say 11 here, not 10. So we have, and that falling off has continued into February and to where we are now, which is 11 active cases the week before break. So that's just some information to consider. All the information I'm giving folks, is pieces of the puzzle and information for the committee to take as you discuss and deliberate the matter tonight. Another area we have is testing. Testing is far more available than it was a year ago. It really has changed dramatically. You see here our weekly in-school COVID testing. So our families, every family in the Gloucester Public Schools and every staff member has the opportunity to be tested for COVID twice a week for free. Okay, that is something that no one even, people hope for, but there was no ability to do that a year ago, or even six weeks ago. Honestly, we've had the weekly pool testing for a while now, all school year, but we have more and more folks signing up for it. And the other piece here is the at-home rapid testing. This is the second opportunity everyone has to be tested for free every week. And the registration of this has been very successful. So far, 413 staff out of about 630 staff are registered for 413 out of 630. And then 1,200 students out of 2,800 students. So, which is great. We'll keep supporting folks to sign up. We will ask participants to test prior to the return from February break. So families with their tests that they got last week should be testing this Friday by the regular schedule. We'll communicate to them the next day or so, urging them to hold off on that test unless their child's symptomatic. If a child's feeling ill on Friday, they should test definitely, and hold that test to Saturday or Sunday before the return from break. Okay, and then our staff have the test to be able to do that. That's one of the ways that's one of the ways I'll talk about that we'll have to know what's happening as we return from break. If folks do the at-home testing Saturday, Sunday before break, we have pool testing on that Monday or Tuesday, and then another round of at-home testing later in the week when we come back. So we'll talk more about that. But those are really the vaccinations, the testing are very, very different than we had a year ago, and really give us many more tools than we have on what we had. I'm gonna pause there. I know I'm talking very fast, so I'll just slow down. Sorry about that, folks. I'm gonna get into survey results in a moment, but I want to see if folks have any questions about what I've said already.
Seeing none.
Okay, either I talked so fast I can't follow, or that was relatively clear. We'll find out. So before I get into the survey results, I want to be clear about the intention of these surveys. And we've done surveys a lot of different times. Before we came back to school in the summer 2020, I can't remember them, but a lot of different times, okay? What we've always said about this is these aren't votes. This is input. Input for the committee to use in their deliberation, their discussion, and as they make a decision, okay? One thing I'll also say about the data I'll show you is there are real differences. I mentioned this earlier. There are real differences in this data. There's no clear direction from this survey data that anybody should take, okay? But they're informative, they're helpful. And they do point out that we have a real difference of opinion, and we have to honor that and respect that. We'll talk more about that tonight, but the survey data really shows that. So just in terms of what we did, we had 5 questions. There was a staff survey with 322 responses, a family survey with 1,172 responses, and the student survey at GHS was 428 responses. And then today we also did a survey of O'Malley students as well. So we'll show those to you too. That's sort of late breaking information, but we'll share that tonight. So a lot of input. So the first question, this is staff and families responding. What do you want to do about students wearing masks in school and at school functions? Okay, so continue wearing masks, stop wearing masks, or not sure. I'll show the yellow first, which is the staff. Continue wearing masks. 40% of staff who responded want to continue. 47% of staff want to stop wearing masks, and then 12% are not sure. With families, the numbers are quite different. Families are 25% continue wearing masks. Stop wearing masks is 66%, and then not sure 8%. Moving on to what folks say about staff wearing masks. Similar results, really, as the first question. So for staff, continue wearing masks, 40% say we should continue wearing masks. In terms of staff responses, 51% say we should continue wearing, should stop wearing masks, sorry. And then not sure, 10%. And then families, 27% continue wearing masks, 63% stop wearing masks, and 11% not sure. What you see between these two is pretty consistent across the two questions, okay? Also pretty consistent, but differences as well between the two. Different experiences, different work, different situations, but there's quite a range here. I will say this, while there's 66% of families who want to stop wearing masks, 25%, even though it's much lower, is a big number and a big percentage, okay? And we'll talk more about that because we'll see that in the student results as well. The students had a slightly different question, but essentially the same question, but worded a little bit differently. What do you want to do about students wearing masks in school and school events? And that was continue the mask requirement or make mask wearing optional. Okay, you can see that 74% of the 400 or so students who responded from the GHS said that they want to make mask wearing optional, and 22% said that we should continue the mask requirement. And then if you look at the same question for GHS students answering about what staff do, continue the mask requirement was 20%, make mask wearing optional for staff 73%, and not sure 7%. So again, that's the high percentage we have in terms of the results. I'll show a mailing in a second. But even with 73%, 74%, 3/4 of students at the high school responded saying they would like to make mask wearing optional. There are 20% at least who it's important for them to continue the mask requirement. Okay, those are important numbers because if it's 93 to 2 or 97 to 1, that's there are different things, different dynamics going on. Okay, but as we see so far, we'll see it also in the mailing results here, in terms of continuing the mask requirement or continuing to wear masks. 65% of students here say that masks should stop. Sorry, yes, it says yes, masks the mask requirement should stop. So I want to be clear here, 66% saying that masks should be removed, 15% that say no, masks should continue. That's for, yeah. So that was the question they were asked about continue or not. So all those percentages tell us that there's a real difference of opinion, and also difference by role, difference by grade, and difference by perspective. So let's continue on. And then, so a couple more questions here. This is asking all three groups the same question. When a person returns to school after having COVID, should they be required to wear a mask for their first 5 days back in school? So we have essentially a 10-day period. We've been operating for a while about COVID. Recently, it was changed from you're out for 5 days, and then when you come back, you should monitor for symptoms, and of course, we've been masking as well. This question is, when someone returns after being positive for COVID, should they be required to then mask up for 5 days through that sort of that infectious period, so to speak? Okay. As you can say, yes, in terms of yes, they should be required to mask. Staff says 80%, families 59% say yes, and GHS students say 74% yes. In terms of no, they should not be required to wear a mask. Little different story here. 21% of staff say no, they should not be required. 41% of families say no, they should not be required, and 26% of students say they should not be required when they return. And then another question we asked: should unvaccinated individuals be required to wear masks in school? Both of these questions are coming from the DESE guidance. DESE was very clear that they strongly recommend that when people return after being positive, they should stay masked for 5 days. Okay. They also were very clear and strong, in the words strongly recommended, that unvaccinated individuals should be required to wear masks in schools. That is why we asked these two questions specifically. Okay. As you can see down below, in terms of whether or not unvaccinated individuals should be required to wear masks, staff said 63% yes, family said 40% yes, and GHS students said 52% yes, that folks who are unvaccinated should wear masks, okay? Should be required to wear masks, sorry. And then answering no, staff 37%, family 60%, and GHS students 48% saying no, unvaccinated individuals should not be required to wear masks in school. The last piece of information in terms of a survey, and we have this from staff, families, GHS, and O'Malley students. So when should, if the school committee decide to stop the mask wearing policy, when should masks stop being worn? Again, a wide range of answers here. So folks had three choices: February 28th, the day after February break ends, a week later, Monday, March 7th, and the week after that, Monday, March 14th. Okay. GHS students at 51% wanted to have masks end or masks be optional starting February 28th. 19% of students said March 7th is when it should go into effect, and 30% of students, GHS students, said March 14th. Families, 54% said starting on February 28th, 14% said starting on March 7th, and 32% said starting on March 14th. And then staff, finally, 36% of staff said February 28th, 17% of staff said March 7th, and 47% said March 14th. So again, just a wide range. And then O'Malley, the students there, you can see 55% said starting February 28th, 19% said starting March 7th, and 13% said starting March 14th. O'Malley also asked the question here, I don't think that masks should be removed, and that's why you see that 14% there. Any questions about that? We do have I showed tables. We also have the pie charts for all those as well. I've shared that with the school committee. Don't need to go through all those right now, but I did try to summarize the results there. And then also school committee members have seen all the open responses as well. A lot of comments. Again, running the gamut and just a wide variety of input that mirrored the data we showed you, but school committee members have had all those answers, all those responses. We gave them to them on Monday from families and staff, and then last night from GHS students. So they've seen those. Questions? So then the key question is where we go from here. The state, I'm gonna back up a little bit. Some folks are tuning in for the first time and just want to say a couple of things of where we have been. The mask requirement in our schools has not been a local decision. Okay, it has not been the school committee who enacted that. Okay, it's been a state mandate that this school committee and myself could not have changed up until the commissioner announced that he was going to end it February 28th. We did have one possibility of changing that, but we did not hit that threshold. I'll talk about that in a moment. But and this is sort of the details of that mask mandate, the mask requirement for all public schools that the state enacted in August 2021. The state did give school districts a possibility to lift the mask requirement if we reached 80% vaccination, combined staff and students in any of our schools. Okay. Except for we never reached that. We still haven't reached that. As showed earlier and show again here, our combined staff and student vaccination percentages have not gotten to 80% yet. Okay, so we've never been eligible to lift the requirement from the state until now. Okay, and that is why the committee learned of this last Wednesday and scheduled a special meeting tonight as soon as they could. So just in terms of what the state has said is that they will be lifting the mask requirement, and so now it does go back to the localities, the local districts like Gloucester. The masks must continue to be worn in school buses. That's a federal order because of transportation. That's buses and vans. The commissioner has said that they want to prioritize testing, prioritize vaccinations, and it has not made any changes in recommendations for distancing, trying to get as much distance as possible, and no changes in guidelines on lunch. So the only thing that we're considering tonight is whether or not the committee wants to adjust your local school policy, which for the whole year has been overridden and superseded by the state mandate. A couple of things in terms of what the state has said. I mentioned this earlier. The state in their announcement last week strongly recommended, and that's why it's underlined there, that positive individuals who return after 5 days of being out with COVID continue to mask for 5 days when they return. And then also the Department of Education also strongly recommended that unvaccinated individuals remain masked as well. Okay. Hence, we asked those two questions to find out what people thought about that. The other piece here is creating culture of acceptance. I'll talk more about this in a moment, but it's very important as we see this real difference of opinion across students and families and staff that whatever the decision is tonight, we talk about a culture of acceptance and allowing folks to choose what they do depending on what the school committee decides. So in terms of adjusting or changing the school committee policy, and the school committee knows this, but I'll just help the public know. The school committee really has 4 options typically. Continue the policy as is, that means continue to require masks by the local policy. Rescind the policy and have no policy at all. Suspend the policy for a time period or revise the policy. Okay, one of those 4 things can happen tonight. So my recommendation on what to do is trying to take into consideration many things. First and foremost, ultimately, I think we all know and all want to have education done the best it can be in Gloucester. And masks make it harder to do that. I don't think there's any argument about that or any real disagreement about that. The mask has always been about keeping people safe and healthy in terms of in the pandemic. And it's been proven again and again that masks help with airborne diseases. There's a difference of opinion on to what degree, and different studies show different things, but it clearly is one way to help, and it has helped us in a number of ways, okay? At the same time, we know it makes it harder for younger kids speech and language, it's harder to make connection, it's harder to know people, it's harder to sort of live with these, and there's no doubt about that. We've experienced that personally, and we've experienced that professionally. At the same time, every step of the way, we've followed DESI's and the Mass Environmental Health Guidelines. We've done a very good job of following those, whether it was in the very serious unknowns of August 2020, but every step of the way as things have adjusted, more information has come in. As they've adjusted their guidelines, we've adjusted with them. And we haven't looked at other places, we've stuck with them, and it served us very well. One of the reasons for that is they work closely with epidemiologists, they work closely with American Academy of Pediatricians, they have the capacity to analyze statewide data and trends, they can learn things and analyze things better than we can, even better than the local Board of Health is. And we've seen again and again that while the advice and guidance may not always be done in a timely manner, or when I prefer the timing, by following that and being and adhering to it, we've made good decisions that have served our students and our staff well, and kept our schools open, and minimized transmission, and done as much as possible to keep folks healthy and safe, and consider the many variables that go into supporting our children. Ultimately, they are better positioned on support and giving us guidance than any authority we've been able to work with. So my recommendation in terms of the face coverings, and you have handouts and you have these, is that masks and face coverings become optional. We just explain my role with the public here is I provide recommendation to the school committee, and that can be on a number of levels. And including a draft policy, which I've given to you and we will look at. My recommendation is that masks and face coverings become optional, that the school committee would revise its policy so it clearly states that it will comply with any applicable federal, state, or local laws and regulations regarding masks. So if a higher state authority requires, like this past year, you would abide by that law and regulation, which is one of your ultimate task is to comply with law and regulations, not go against them. Any person can choose to wear a mask or face covering for whatever reason they have. Then I recommend the school committee states clearly that it supports any person who chooses to wear a mask or a face covering to support their own health or the health of others. If one of the higher authorities, DESI or the State Department of Education or State Department of Health, requires masks, the exceptions that were in the original policy remain, okay, if the higher authority determines that it's required. And then also, I'm recommending that you allow the superintendent, myself in that case, to institute a short-term time-limited requirement to wear masks in a specific class, grade, or school in case there's any further increase in cases or we have evidence of in-school transmission. But that would be for a specified amount of time that I would share with both you and the public and those affected. But it would allow us to respond quickly if we see that the trend going upwards by either looking at local data like the wastewater or a specific increase in schools or a classroom, that sort of thing. And I'll describe how we would do that in a moment. There are a few additional considerations. I'm recommending that we start on March 7th. While there wasn't a significant increase after February break last year, there have been in other breaks. February break is coming up very quickly in about 48 hours for everybody. And so I'm concerned about starting immediately after break because we won't know some of the data about whether or not we've had an increase. We'll be able to figure that out quickly because of the at-home testing and the pool testing. So we'll have data very quickly on that. But it doesn't allow us, I feel, our schools to be ready to adjust the rules, adjust what we're operating, and also communicating and messaging to families who aren't listening tonight, many of them aren't, and make sure they know what's coming ahead. It also gives a little bit of time to sort of adjust and get used to what amounts to a very significant change that many folks in the district have some real concerns or trepidation about. Transportation, as I said before, transportation at this point we still will require masks and face coverings on buses and all school transportation. That's a federal government order. That's something we can go against. And then returning to school after being positive, I'm strongly recommending that all those returning after being positive for COVID wear masks for 5 days after return. While I would like to make this a requirement, I think it's the right thing to do in terms of science, and we should talk more about this. It's a difficult thing for us to enforce because of privacy issues. We can't tell teachers if a student has had an illness. We can't tell, so at that point and we can't do that. So therefore you don't know if someone is required to wear one or not. We don't know if they've been sick or not. While our nurses may know, or folks, families may tell a teacher, that teacher or that nurse isn't able to tell and should not tell anyone else about that illness. So, but I do think that we need to have some really strong messaging to families on a number of things. One, continue to stay out stay out of school if there's symptoms or illness, and also this as well. Let me just see here. A couple of last things here. One of the questions is what we would do and what would we do to move into a different phase? I mean, I guess we're saying this. We're in a different phase now, and we're entering a different phase of living with COVID. Before we're sort of, I can't remember how I said this, but we're moving towards living with COVID and knowing what that means in an endemic, really, rather than a pandemic. But part of the reason we can do that is we have many more tools than we've ever had to identify and protect ourselves and our students, our staff, and our families. We have a tremendous amount more information than ever about who gets sick, what helps to protect them, what variants occur, and how quickly we get information about variants. We knew Omicron was coming, for example, and we knew part of what it was doing. Vaccination boosters are readily available, and as you can see, 60–70% of our staff and families, the folks in our schools have them. Testing is readily available more than ever before. Our wastewater testing is more widely used and understood than ever before, and also better medications are becoming more widely available. So we really are in a different place. For me, sometimes it feels like Omicron wasn't that long ago. It wasn't that long ago, and that can make me nervous. But when I realize and sit back to see where we are right now, what happened last year in terms of pathway forward, sort of the last gasp in terms of infections last year in our schools was in late March, a small bump up to 17 active cases, and then it basically from February, except for that one blip, cases kept on going down. Okay, and we're hoping for that same trend. But if we don't, you'll be able to identify that, pay close attention, and then make adjustments if necessary. Let me just say this. If cases increase, we'll communicate. Principals and the superintendent will continue to report weekly about active cases to all families and our total cases. We'll talk about percentage of students vaccinated, and we'll also make sure that folks know about upcoming vaccination clinics. Myself, Nurse Leader Jeff Parker, who's on tonight, our nurses, our COVID case management team will monitor any increases we see, especially if there are any patterns and causes. Whenever we see an increase, just like we've been doing for a year and a half or more, we check with the local Department of Health, we check with state epidemiologists, we check with DESE to help us understand these patterns, and if we need to respond, and then we never been hesitant to respond, whether that's increasing testing, whether that's closing a classroom or a school, and we'll be able to respond the same way if we need to by working together. The last thing I'll say before questions and discussion is really speaks to the moment we're in and the data we've seen and emails we've gotten. There's a real range of feelings about this, thoughts, opinions, and comfort level, okay? And if the school committee decides to make mask optional tonight, we still have a lot of work to do. And that work is around supporting each other. The worst case scenario I can imagine is if a student or a staff member choose to wear a mask and for any reason don't feel comfortable wearing that mask. Folks will wear masks, and they're right to wear a mask for any number of personal reasons. It could be they're protecting their own health. It could be they've been sick recently. It could mean they have someone at home who's elderly or immunocompromised, and they want to protect that person as best they can. So it is really paramount that tonight, tomorrow, next week, and all the weeks the rest of the school year, that if folks choose to wear masks in school, that everybody supports them. That's families tell their children. That's myself telling everyone tonight. That's our principals messaging the families. That's students talking to other students. That's teachers talking directly to students as well. We need to actively communicate our support for anyone who chooses, who makes a choice to wear a mask. Folks around the state and the schools are worried that students will comment on their students. I know Gloucester can do better than that. Gloucester is better than that every single day. And we'll do everything we can to support folks' choices on this. But it takes much more than myself. And perhaps some of our most powerful messengers are our teachers and also our students helping each other. So I think Gloucester's done a great job of supporting each other. I think we can keep on doing it no matter what the decision is tonight. And I will stop talking now and happy to answer your questions. We also have two members of the Board of Health here tonight. Director of the Department of Health, Max Schenk, and also our nurse leader, Jeff Parco, to answer questions of folks. And those questions can come from anyone around the table.
Also from the Board of Health, we have Joe Rosa, who's the chairperson, and
Dr. Eric Kaplan.
Dr. Eric Kaplan. So if anybody has questions, we direct them to who you think is probably best to answer your question. Go ahead, Laura.
So I just want to say thank you first for that very thorough presentation. My question is around the process or the metrics that would be in place for you to make a decision that we're going to, start mask wearing in a classroom or in a school, or sort of what you're looking at for how that would work. And then secondly, how we would then, if we needed to in Gloucester, if we felt that the cases were going, how we would move to a district-wide situation.
Sure. So a couple of things. Folks have asked again and again for heart, and you're not asking this, but the metrics question has always been a good question. And I might want to defer to Max Schenk here in a moment, but we've taken sort of metrics case by case, and it allows us to be flexible and consider each instance on its own. So, for example, when we had uptake in Beeman, in December, we we saw some cases happening. The first question is, are they happening in the same place? Okay. How many of them? What do we know? So consulting with principals and teachers, what do we know about what's happening here? Have we heard from families about where it could have come from? Okay. And then we're watching, through testing or other means, is it going anywhere else? Okay. And then we made a decision, right? But whether that's, 2 in a classroom or 4 in a classroom, or 4 in a grade, we are responding to what's the path it's taking and the information we have, okay? But that's the sort of thing we look at, okay? Another example would be with the semi-formal, I think it was, here at the high school, learning and knowing that some cases were coming from that, and understanding from talking to students and their help, and also staff members, that while that seemed to be a place where maybe things started, we also knew that it was also happening outside of school as well. So is it an in-school issue or is it outside issue? Again, that sort of information gathering helps us decide. In that case, it wasn't going through the school. We knew the transmission was happening. We had a good sense transmission happening outside of school, but wasn't spreading further. So we actually didn't have to take any action there. We may have offered some more testing to people. I think we did at that point. But where this will begin, I believe, is, thankfully Gloucester has the weekly wastewater testing every week. That's something that as soon as I get it every week, I look at it, okay? Because that's really the first indicator, and if we see that, then we're, taking note, is it going up? How steeply is it going up? Talking to Max at that point, seeing what we're hearing. But then we're taking, as I just described in two examples, specific cases at each school. Jeff Parker does a great job of keeping you informed. Last year was every single case. This year was sort of every day or so. When he sees numbers going up or I see numbers going up, we start asking questions immediately and then we go from there. So I think those are, I hope that helps. But that's sort of more the process we take. And it's vigilance, it's monitoring, it's conferring, consulting, and that's consulting here, but also statewide experts, statewide support, and that's how we make a judgment, and then we take action about. And in this case, it would be masks probably wouldn't be one of the first things we take. We operate on, and then to develop a lot of communication with families, why, for how long, sort of.
Did you say masks would or would not?
I think it would be one of the early ones. Yeah, definitely. Oh yeah, absolutely. Yeah. My policy or recommendation, the draft policy you have, for a district-wide change, that would come to the school committee, and that'd be the school committee decision.
Mayor Berger has a question.
Yeah, I'd like to hear from Joe, Rosa, and Dr. Kaplan and Max. The Board of Health certainly proved that they weren't political on this one. They didn't go by the applausometer, because they took the tough decision to reimpose the mask mandate back in January, I believe it was, and then did a science-based decision last Friday when they lifted the mask mandates in public buildings and publicly accessible places. So I'd like them to weigh in, and I'd like to hand it over to Joe through the chair, if he could sort of give us some of his insight. Oh, Joe, you're muted.
You're still muted.
Sorry, folks.
There you are.
So, sorry. I was starting to congratulate the superintendent on a very good and extensive and well thought out presentation. So the board considered two criteria or metrics for basing our decisions. And the superintendent actually mentioned one, which was the wastewater numbers, which basically are a metric that tells us what the prevalence of the virus is in the community. And you saw that data, and it is has been a very good monitor for what is likely to happen in a week or two within the city. However, we had another metric because Omicron is not as virulent. One might think that hospitalizations were not to be a big problem, but because it's so transmissible, all the events, those few events that might happen, a small percentage, still happened in a very short time period. And consequently, the hospitals at an early stage of the Omicron epidemic overburdened the hospitals, not just in Gloucester, but throughout the state and indeed throughout the country, and in some parts of the country, it continues. And so that was our second metric as to whether or not ICU beds were going to be made available for people with heart attacks and strokes, because this time of year, especially, ICUs are typically close to capacity, and even a small number of increased numbers can put people at risk that really need those beds. And so Dr. Ganem, who's also a member of our board, has been tracking the capacity of ICU beds at Beverly Hospital and indeed throughout the Leahy system. And while that peaked a couple of weeks ago, it has come down. And so ICU beds are becoming more and more available. COVID patients that occupy them are becoming fewer and fewer. And so both of the metrics, the wastewater numbers, as well as the availability of ICU beds, the hospital burden have greatly decreased. And so those were the bases of our decisions.
Thank you, Jeff. Okay, anybody else have any other questions? Bill?
Through the chair, yes. Ben, in deliberating your recommendation, at any time did the thought of potentially a phased-in demasking come into play? I mean, saying this, the high school's at almost 80%. Maybe we do the high school, wait a week or 2 weeks, and then do the elementary schools. Did that?
I didn't think about that. I mean, I just didn't consider it.
Yeah.
And then the other thing I'd add is I haven't heard that from other superintendents either. I'm not saying maybe someone is, but the ones I talked to were North Shore superintendents, in at least 2 different conversations, not more. It just didn't come up.
Yeah.
So again, not weighing in on the merit of the idea, but just I didn't really consider it.
Yeah.
Yeah, to the Board of Health, maybe Max can answer this. What are the vaccination rates for the population at large for Gloucester? Do you have that on hand? And
Yep.
maybe broken down by age group?
Absolutely.
Or do you know off the top of your head a roundabout number?
Okay.
Hold on one sec. So we don't have it down to the minutia, but the most recent numbers for those 5 to 11 years old, percent with at least 1 dose is 61%, percent with at least 2 doses is 50, from 12 to 19. And I know, again, these are wide swaths. Percent with 1 dose is 85%, and percent with 2 doses is 76%. We are, as mentioned before, and this will actually be a good opportunity to give a shout out to Jeff Parko and his team, who have been doing yeoman's work, as we know, and but also, with gratitude, thank them for the work that they're doing to set up the vaccine clinics at the schools. Right now, that's our major focus. But for the age group I think you're interested in, that's what we're looking at right now. Pardon me, just 1 second. This information is on our website in case you need it. Let me get back to it. For 12 to 19-year-olds, the percent of individuals who can receive or have received boosters is 25%. So, first dose is pretty good. Second dose, not, getting better, but still in the 70, 50, 75% range.
So do you have Gloucester at large as a total population?
Absolutely. So Gloucester total eligible fully vaccinated, which means technically it's the 2 doses, is 83%, and the state total by comparison is 79%. So we've actually eked out the state as an average a little bit.
So effectively, you've reached the 80% benchmark as a population.
As a population, that's correct. But there's still, I want to remind folks, given that number, the boosters are now the main thing. So we're at that stage in the vaccination process where boosters are becoming more and more important in order to ensure the most effective means for preventing severe illness from COVID. So, as a for instance, if you look at, we'll leave 12 to 19-year-olds and go to 20 to 29-year-olds, that's 31%, 30 to 49-year-olds, 43%, 50 to 64-year-olds, 55%, and it gets better as we get older. 65 to 74-year-olds, 76%, and 75 plus is 74%. So there's still a lot of work to be done on that. Now you also have to take into account the fact that a lot of folks just became qualified to be able to get the vaccine number one, and then be able to qualify to be able to get the booster. So there's a lot of catch-up work to do there.
So you would probably consider, so what you're saying is that you would actually consider fully vaccinated to be dosed 3 times?
I would consider that, yeah, correct.
Yeah, and I mean, these are some pretty high percentages, and we just had the Omicron wave, the Christmas present we got. Honestly, I think these are impressive numbers, but obviously it didn't prevent the Omicron wave. And I know there's another vaccine in the works. I hear rumor of specifically for Omicron. So I guess, my question is, do you factor in natural immunity? I mean, we obviously just went through a high percentage of the population getting Omicron. And do you plan to factor that into any future Board of Health decisions?
That would have to be a decision of the board, quite honestly. And in order to be able to answer that question, you'd have to ask it of the full board. At this time, it hasn't been discussed.
Okay.
Yeah, sorry.
Yeah. I'm a freshman committee member, so I forget protocol and all that stuff.
It's quite all right.
Do you have any questions for anybody?
I was just gonna ask, do you have a recommendation on unvaccinated students and how you would enforce it, considering it's kind of hard to differentiate between the two?
Yeah. So my recommendation to the committee, I do not comment on unvaccinated individuals. And it does come down to similar things. We can't tell folks anyone's vaccination status. We can't share that, and so by not sharing that, then it becomes unenforceable. There's no way for us to know who's if the committee required unvaccinated individuals to be masked, then we have no way of telling our staff or administrators who is unvaccinated, who's vaccinated, who's not. And so then it becomes essentially an unenforceable policy, which we try not to create those. So that's really the primary reason that I'm not recommending that we do anything about that. I think, yeah.
I have a couple of questions to a couple of different people,
Okay.
but they're not long. So first I want to say thank you very much to the superintendent and chairperson Kathy for giving us such a huge amount of information in such a short amount of time over the past week. I mean, we have surveys, I asked for legal opinions, I got those, asked to have medical people here, we have that, so tremendous amount of work. I mean, I could honestly say this is like the blue ribbon panel that we could get in Gloucester, and are you laughing at me?
No, I just think
Oh, I thought I said
that's just
something
like
wrong.
yet another phase of dealing with COVID.
Right, yeah, so thank you both, because I came to this meeting with everything I need to do what I have to do, so thank you for that. And just want to give a huge shout out too to the 229 attendees that are on watching and all the emails we received as well. I want to give a big shout out to having the Board of Health here. I find comfort in the fact that there's another board out there that is struggling and agonizing over COVID. Not that I would wish that on anybody, but they've done some great work during difficult times and had to deal with a lot of pressures that we deal with, including this night. So I guess my first question is directed to the Board of Health, and I don't know who would want to answer, so I'll put it out there and you can decide. So in January, with the Board of Health meeting, I think it was the first meeting you had, you recommended a mask mandate. to put it into place to react to what was going on in the community after the holiday. And after a very long discussion and weighing in on everyone's opinion, the mask mandate that came out of that session was masks go back on in Gloucester. However, if you're going to a restaurant, you don't need to wear a mask unless you're a worker in that restaurant. And going to the gym, and I think it was specifically mentioned the YMCA, you did not have to wear a mask while you were in there. Didn't even need to walk in with one, same with the restaurant, unless you were a worker in that environment. So that was the vote that was taken and walked away from that. So I guess my question is, knowing that all people were not masked for a good, in those situations, in the restaurants and in the gyms, a high percentage volume of people in those facilities were not masked. Was there any uptick or what do they call it when there's a mask cluster or anything as a result of having that limited mask mandate? A lot of people thought we had this really strict mask mandate, but if you looked at it, it wasn't as strict as some communities did. So I'm wondering, was there any uptick or fallout from having that type of mask mandate, knowing that in restaurants and gyms where there's a large amount of people not wearing masks, what was the result of that?
Yeah, it's a difficult question to answer simply because you can't do the experiment, right? It'd be nice to do the experiment, put people at risk, I suppose.
That's what we did, right?
No, but you don't know what the outcome was. I mean, as far as I know, Max, you can comment on this. I'm not aware of any demonstrable uptick that could be associated with those particular instances. Max, I don't know whether you have anything to add to that.
So the short answer to the question would actually be we need to do an analysis after the fact to see what the results were. So we receive case numbers, every few days. We try to, quantitate them towards the end of the week and share that information as best we can. But honestly, I would have to go back and see where we were in that curve, because if you remember, it was launching upwards anyway. And it spiked not long after we had instituted the mandate. So whether or not it was cause and effect, it's hard to know. But we'd have to look at the information. I could pull it together and give it to you.
But it's fair to say that since that mask mandate went in place pretty much in January, that we started the downward trend. It didn't spike up knowing there was people gathering in a large area without masks on. Or am I wrong in that?
No, that's certainly true, but
Okay.
To assign cause and effect is dubious.
Okay. I get that. Thank you. And my second question to the Board of Health was, and I didn't get to watch every meeting. I didn't really start paying attention until late December in your discussions, and I apologize for that. Was there any discussions about the mental health impact of wearing a mask in any of your decisions when you did a mandate? I know Claudia Schweitzer, and I apologize if I say that wrong. I know she's a mental health expert that was on the board, but were there any conversations about the mental health impact of wearing a mask, or if you determined that there wasn't?
I don't recall, Max. There may have been some discussion, but it was relatively brief.
Yeah, if I can, through the chair. So there was a conversation briefly between Dr. Ganem and Dr. Kaplan. Dr. Kaplan is a pediatrician from Lowell. Dr. Kaplan, you can obviously give your CV if you'd like and your experiences, but Dr. Ganem's wife, if I remember correctly, is a pediatrician as well. And so there were concerns raised by her, but the debate went back and forth as to whether or not there was, in fact, a broad-based impact, on emotional health. But Dr. Kaplan, if you have a memory of that conversation, go right ahead.
Yes, I actually am retired, but I called my my group where I practiced, and they were not seeing a great uptick in really severe psychological problems. There was some stress, but not enough that it was not enough to make it out of the ordinary.
Thank you. And Rosa, you were talking about the metrics that was used for the Board of Health, and it took into consideration ICU facilities being full, which makes sense because you want access to those types of services if needed. And I believe at your last meeting a couple of weeks ago, or was it last Friday? Yeah, I apologize for the time. It was stated that we were aware that the ICUs were pretty full, but not filled with COVID, but still full. Is that correct? And do we know if those statistics are the same today?
My recollection, and Max, you have a better memory for these things than I do, but my recollection is that the ICU capacities were declining from capacity, and also you might say attributable to the fact that the number of COVID patients in the ICUs were decreasing as well. So both metrics were going down, which is what our objective was, to make sure that there was room in the ICUs for the more traditional needs of heart attacks and strokes, et cetera.
Right, thank you.
Forgive me, my memory on that is that there were 25 COVID patients in Beverly Hospital, and of those 25, 2 were in ICU.
Right.
Thank you. And to Max, you might know this the most. Do we know of any children in Gloucester, students or children that have been in the ICU or currently in the hospital with COVID? Or recently, like in the past?
We have 0, yeah, the latest numbers are we have 0 cases in the hospital right now. So okay. I would think the answer to that is no.
Do we know if there's been any students hospitalized in the past 30 days? Or young children?
Well,
you may not know. I'm just asking if you do know.
It's not even a matter of knowing. It is a matter of being respectfully ignorant. So I have to be, our nurses have to be careful as to what they're sharing in terms of medical information. So I will get statistical information, yes, but I will not get, who's who and who's where and who's in the hospital.
Great, thank you. And I have one question to Jeff Hucko, if he's willing to answer a question.
All of them.
He's just hanging out.
No, he's not just, he has nothing to do than just hang out.
Jeff, I have a lot of respect for you, so I'm saving this question for you.
Thank you.
It's important in this decision tonight to make, to try to understand. So we're in Gloucester. We have neighbors. Rockport, Essex, Manchester. Those are our immediate neighbors. Mask mandates have been dropped in all communities. It was reported in, oh, I'm sorry, I thought they dropped their city one already, not their school one yet. So it was reported in the Times today that Manchester voted, I think it was yesterday, their school committee voted to end their mandate effective February 28th. And the question was put to their school nurse, which is why I'm asking you, the head of our nurses. Is there a difference in the February 28th date versus a March 7th date versus a March 14th date? And that's kind of the issue here tonight, correct?
That is certainly a bullet point of the decision-making process.
One of the issues, right? So I'm sorry. Let me just finish real quick. Let me just wrap this up because I know other people probably want to talk. So it's in the new, and I'm quoting the Times, so I'm not quoting personal knowledge. It says, Joanne Seaman, the school nurse at Manchester Memorial Elementary, said it won't make a difference considering the district's current COVID-19 prevention procedures. In January, the district received the state-issued COVID-19 test for students to take on Sundays before returning to school. So their school nurse has taken the position that the date doesn't matter when to take the mask off, because we now have these tools. We're sending parents home every week with tests. So there's an ability to test immediately and then come to school and get tested a couple days later. So I'm curious to know your thoughts, knowing we have a school nurse next door in Manchester that have the similar statistics as Gloucester. Manchester and Essex are the same community. Essex sewer water is in our test because we test Gloucester and Essex together because we share the same water treatment facility. So we're very similar to that community. So I'm curious to know what your recommendation is or what your opinion is on the difference in a February 28th date versus a March date.
So my opinion on this particular postponing from the 28th to the 7th would allow the schools to offer the testings, the weekly testing offered on Mondays and Tuesdays, and the at-home rapid tests on Friday. Because historically, we have seen an increase of cases after all three of our breaks, some more so than others, it would allow the schools to tactfully respond to that. So my personal opinion would be to wait till the 7th to lift the mandate. I'm not saying it's going to make a groundbreaking difference, but it will allow us to get communications out, get a good feel of any increase in cases from the vacations, international travel, interstate travel, and just make sure that we're doing everything we can as we have. We have always been in sync with DESI's recommendations, and I don't want to overstep that, but one more week in the grand picture, the large picture, I don't think that will have a significant negative impact just to make sure that we are doing everything we can. Yes,
Thank you very
Max?
much. That was very nice. Thank you, Jeff. I appreciate it.
May I, just for a point of clarification, when it comes to the wastewater that comes from Essex, it's not, it's a very small corridor of, that we receive from Essex. Most of Essex is septic systems. So we may, there, and that septic system waste, gets pumped possibly every 2 or 3 years and could come to Gloucester potentially, or more than likely goes to Ipswich.
And like Gloucester, we have a very high amount, like myself, which have septic systems here, so I know my house isn't getting tested. So it kind of goes both ways, right? A lot of septic systems on this island.
Yeah.
But thank you. That was helpful to know. Sam,
You're
you have a
welcome.
question?
I just more have sort of a comment to sort of frame Melissa's mental health question. As a committee, we've spent a lot of time sort of thinking about the mental health impact on all the decisions that we've made in relation to COVID. And I just want to be careful because we can certainly speculate that masks have sort of a detrimental impact on maybe educational outcomes in terms of like speech or facial recognition. But I think it's really hard for us being sort of in the mental health field to isolate the impact of mask wearing in relation to just living through an overall pandemic, right? That's inherently stressful, that's inherently difficult, and it's been really hard for families and it's been really hard for children. And I think it would be nearly impossible for us to say that mask wearing alone is what's impacting kids' overall mental health. So I think we just have to sort of think through that carefully. It certainly has an impact on lots of different factors that are less than ideal, but in terms of a mental health perspective, we are living through a very difficult time, and that's going to impact kids on lots of different levels. So I just don't want to pinpoint mask wearing as being the only thing that's going to impact kids' mental health right now. Laura?
I just, Jeff, I wanted to sort of follow up and just ask, because I looked up Manchester's vaccination rates just as a comparison. And so what I'm seeing on their website is that of their residents 5 to 11 years old, 73% of the first dose of the vaccine and 64% are fully vaccinated. But just to compare, like our rates are just not that high. And that has some impact on the calculations. Is that true? That's for you, Jeff. Sorry. For Jeff.
Jeff, she's.
I don't understand the question.
Well, I'm
He's
wondering.
getting unmuted.
Oh.
Yeah, so,
Can you just clarify?
yeah, if you could clarify the question, the rates you just put forth were the global K through 5?
Well, we're asking, Melissa asked a question about the Manchester school nurse and how you would respond to the Manchester school nurse.
Yeah.
So I just looked up the Manchester 5 to 11 is how they have it on their website.
Yeah.
On their vaccination rates for 5 to 11. I can't speak to anybody's calculation, but when I look at that as a layperson who's not a medical professional, I noticed that they have higher vaccination rates for that young age group. So I'm wondering, and I guess this could be to you or to Max, if that plays into thinking about how we move forward.
So do vaccination rates
Right.
mean, is that what you're asking?
Right.
I'm trying to understand your question.
Right, because
If
what I-
vaccination rates make a difference in their opinion as to
right, how
taking
do
the
our,
mask off.
right, when schools have lower rates versus higher rates, how does that impact decision-making around this?
That has certainly been a discussion nearly every time we go through what is best for our school community. I think the vaccination rates reflect when the opportunities were available and when people were eligible to do so. So you can see that our rates from middle school, it was more so 7th grade and upward, were eligible on the first rollout of vaccination for the school age students. Then you can see on our K through 5 level students that the rates, yeah, it's a little bit lower, but I think with all of our efforts in on-site vaccination clinics, community clinics through the public health department, that's my biggest focus, is getting everybody on the same page, understanding that the vaccine is to reduce hospitalizations and poor outcomes. If we can all work together to get to that point, that is going to be what is best for the community. Masks are one tool in our toolbox to assist with this. And the current vaccination rates, I really wanted to get to the 80% benchmark, because that is what Desi put forth. We didn't quite get there. So it's certainly a factor. We have been going through this for quite some time. It is absolutely a consideration, but I don't think that is the only deciding factor that would guide the decision, because the more we get information into the hands and of the family members to better understand the reason we're getting vaccinated, I think we're going to have a lot more buy-in and a lot more of a successful vaccination rate in the community.
Thank you.
Bill, you have a question?
Yeah, well, I guess it is a question maybe towards Ben. The one question in the survey that really stuck out to me, Ben, was that if the school committee decides to stop the mask wearing policy, when should the mask stop being worn? It's almost like if you took the February 28th response out, most people would prefer March 14th, which is the numbers indicate that. Am I reading that?
Let me just pull it up, because I think actually, I think that it's actually the barbell. They either want it the soonest or the latest.
I see.
Yeah.
And that's how I'm
Yeah.
reading it.
No, I think I picked the least favorable option, actually.
Yeah, right, you did.
But no, it's the, I mean, and that to me, I mean, if I put, May 3rd out there, we would have had, I think, a whole bunch of folks saying May 3rd, okay? So, but in terms of the March 7th, I don't know if there's science, I don't know this, okay? Maybe someone knows this better, that we'll say there's a significantly large difference on February 28th or March 7th, okay? What I do know is that effectively February 28th is 2 days from now. In terms of the schools being prepared, okay? In terms of the very important work we need to do to work with staff and work with students, in terms of what I said before, which is we have got to make sure that we have an environment that allows for all of it, okay? It does give us some more data, especially because we do have this question mark about coming back from school vacations. I mean, that's present. That's in many people's minds, okay? And we really have 3 bites of the apple there. If folks do at-home testing Saturday, Sunday before we come back, we have the pool testing in school on Monday or Tuesday of that week we come back, and then again on Friday. three bites of the apple to see exactly where we are, our school community is, in terms of COVID. I don't expect, I'm hoping change that there won't be, any indicators saying we should change things, but it gives me peace of mind to have that information. I think it gives many folks in the community peace of mind on that, assuming that's good news, and hoping good news, but whatever news it is, I think we need to know. And then it also gives, I think, folks some time to come to terms with it and sort of normalize. Okay, this is where we're headed. Instead of jumping right in as soon as we possibly can into a very significantly new and different phase, we have some time to adjust. So that's really it's more about, I think, a human side to it rather than a scientific side to it. And that's, but that is also taking into account that there's real variation, a real wide range of where people are on this matter.
Respectfully so. I mean, it's totally respect that people feel differently about it. My question, and my dovetail question into that is, if we say March 7th, if they come back from vacation and all of a sudden March 7th, we've said, okay, we're gonna demask on March 7th, and all of a sudden we get some results during that kind of, when we get back, do we reconvene and say, wait, we got a real problem? All of a sudden we got a problem here, or do we?
You have a meeting on March 2nd.
Well, okay.
It's already scheduled. No, I mean, I think there will always be the ability for this committee, if you have a mask policy in place, to put it back into effect. Okay. And I would always advise you to do that based on data that we have, local data, wastewater data, what's happening in schools, that sort of stuff. And so whether that's that week or 6 months from now, if the health data shows you've got to consider it, you as a body, then I really hope you will. At this point, I don't know if Max, if you want to talk about this or not, but we don't have any indicators that's what's going to happen.
Right.
There really aren't. Wastewater is telling us that, and it would. Literally at this point, 2 weeks from now, it would be given some signals that it's not. So I don't see any reason to do that, but it is, like I said, that human side of it, as opposed to the science side of it, maybe also.
Exactly. Well stated. At some point, we're taking a risk. We're taking a chance. We're saying, we're trying to minimize that risk as much as we can. We're saying, well, maybe if we wait till the 7th, that's as minimized as we can get without getting run over. But could we get the same thing? The question really, I think, for us is, are we willing to risk the 28th and versus the 7th?
Sam, you have a question?
Yeah. So when looking at the survey results, you didn't present on this question, but the question was, would you like information about our free at-home COVID testing program? Your children can get free COVID tests every week from the Gloucester Public Schools. So 48% responded, I've already signed up. And 43% said, no, thank you. I don't really want any more information about it. So I'm wondering, with a large audience here, if it would be helpful for maybe Jeff to sort of comment on how using this tool, taking advantage of this tool, will help us potentially prevent us from needing to implement masks, but because we'll be able to sort of pick up on cases in a more timely manner before there's actual considerable spread. I was actually pretty surprised that almost 42% of the respondents sort of are like, no, I'm good. It's a free tool. It puts tests in families' hands. It allows you to not have to pay for them. It allows you not to go to the store for them. So for me, what do we need to do to communicate the importance of that tool to families so that we're at like almost 100%?
Yeah, you've made the response quite easy with your lead into that, because you've highlighted many of the reasons why we have so many testing opportunities. I would also like to point out that Stage 4 Park also has a pop-up PCR testing site readily available for everyone as well. The more members of the school community that we get engaged with the weekly testing early in the week, the at-home testing on Fridays prior to work or school, and knowing that we have weekend PCR testing, or it's week-long testing available for PCR up at stage 4, we have all the tools. At the end of the day, the more people that we get engaged in participating, the more cases that we will identify and mitigate the spread. So we will continue to do outreach, as we have been very clear about prioritizing the vaccination status and promoting vaccine clinics. That's our #1 priority. Number 2 on my list is getting the school community engaged in the programs that we have available. So between those 2 tools, we're doing quite well mitigating the spread. You can see our case count today was at 11 cases. That is in a very large part to do with vaccination rates, as well as the availability for testing. So we will continue to promote. It just gives us, rather than a small snapshot of the global picture, it's giving us a much more broad picture. And you can see by the registration rates and the testing numbers that we have a pretty good picture of our schools right now.
I just add this, is that Jeff, myself, and principals can't be the only ones who need more help communicating that. And the most powerful communicators in this community are students, okay, and parents, okay? Facebook, as I've learned in Gloucester, is a thing, okay? We need more parents saying, do this, it helps. Do this, it helps me with peace of mind. It helps me if someone in my family is gonna have, one of my kids is gonna have COVID, I know early, then I can take care of that person and my family. So with students activating, we need your help on this, to get other students to sign up, and we need parents to activate too. We just have limited impact, the principals and myself. But the 2 most powerful groups in this community, any community, are students talking to their friends and families talking to their friends. And so whether it's Facebook, in school, if we can activate those 2 groups to support free testing, it's a big deal.
One thing I didn't highlight was that DESE did revise in their last webinar that the at-home testing, if you're registered, they encourage people, if you are feeling any symptoms, to utilize those kits prior to the Friday date. That way we, again, have another tool during the week to capture additional possible cases of COVID. Dr. Kaplan, you've had your hand up for a little while.
Wait, Jeff, we're gonna let the chair call on folks, okay? But thank you.
Sorry. He was trying to get when I was talking.
Thank you, sir.
I do it all the time, Jeff, don't worry.
Dr. Kaplan, are you responding to one of the questions?
Yes, I am. I
Okay,
just
go
wanted
ahead.
to remind everybody that the dates of the BioBot, this is one of the things we used for the Board of Health decisions. They come out on the 4th and the 11th. So whatever's decided, those are the day, we get those results during the day on the 4th and the 11th. That's Friday. So if you don't stop the mandate on the 28th and you go a little further, we will have some pretty good data fairly quickly after the school vacation.
Thank you.
Just wanted to make sure everybody knew that the dates that we will have that information.
Okay, thank you very much. Melissa, you had a question?
My question is to Ben.
Yes.
And I'm going to start by saying I'm asking him this question, and I'm able to say I agree with 99.1% of 100 with everything you said tonight. Okay? I have to ask this because I'm trying to, the way my brain works, I need to ask you this question, okay?
Train a lawyer, I get it.
And I also want to start by saying I feel your frustration with the communication piece, but I come to this meeting tonight knowing all the conversations I've had with many people on this topic for many months, not just because of this issue.
Sure.
Believing that most parents have made up their mind tonight already how they feel. They've already made their decision, most, not all, still can be, I believe there's some to be persuaded still, but most have decided whether they're gonna get their child vaccinated or not. Most have decided whether they want to sign up for testing and or not because of privacy issues and things like that. I'm not saying we can't do a better job in getting that information out, But in my opinion, I think a lot of families have dug in their heels where they're at right now, seeing this wave of Omicron come and now leave, and they feel a little bit more confident. COVID isn't as scary as it was a couple months ago. That's just how I feel. I'm not saying everyone has to feel that way. Those are the kind of conversations that I have. So I need you to help me understand, because I have the utmost respect for you. I remember when I met you after we hired you and walked away.
We're questioning.
There's a question coming.
deliberating, right?
Well, this is the question.
Okay.
So I walked away from you with this sense, a strong sense that you always go for the underdog, and I really appreciated that on you, okay? So tonight, we have all these surveys and studies before us that you put out, and we appreciate that. And the way I view them, looking at them and seeing the O'Malley ones today, there's a majority of families out there, I think we can say there's a majority of families out there that want masks off for their children now as soon as possible. And there's a majority of students out there that want masks off as soon as possible, like just the majority. And I appreciate when you say, you know, there's that 20% that we have to pay attention to because those are real feelings, right? So this is where I'm struggling a little bit because I'm hearing your message, and I go back to a year and a half or 2 years ago when we surveyed families and we asked them, you know, we wanted them to reach out to us, send us emails. We got emails. We did surveys similar to this. Do we want kids remote? Do we want to be in school, right? So we wanted that input from the community because we made that decision on that. We had instruction from DESE, and we got the results from the parents and learned 75 or 70% wanted their kids in school. And we used that data to make the decision we wanted to make. And it was the majority decision, right? 70% of parents wanted their kids in school, even though the teachers at that time didn't want to come in. We relied on that data from families that this is the direction we're going in because that's what families want. So tonight I'm struggling a little bit. And with, like I said, with no disrespect, and I'm trying to understand the time that you need. But here we have an overwhelming, well, not overwhelming, but a majority of parents that want to make their family choice by taking their masks off. The students want to make that choice, but yet you're delaying it, saying we need more time. And I struggle with that because you have the MIAA that came out saying February 28th, which means in all school districts, sports don't have to wear masks. You have the DESE that said February 28th. You have the Mass Department of Health that I know has weighed in saying masks don't need to be worn after February 28th. I know they weren't specifically saying schools, but that big department of experts believes that now you don't need to wear masks, that it's more of a personal choice, and you look at your personal situation, which I have situations in my family, so I can relate to that choice in a way that I have concerns about, more so than defending it. We have communities that are willing to go quick. You had a Beverly superintendent that came out of the gate day one and said, we're not wearing masks after February 28th. Parents, we need your help over February vacation to talk to your children, to let them know that it's okay to sit next to a student with or without a mask, that there is no bullying on either side of wearing the mask. So I'm trying to understand, we have this data tonight that you brought to us, but yet you're not going by the data. You're picking a date that has the least of the majority for a start date to take the mask off. And I don't believe you're giving the families as much voice as you did in the prior survey. And that's concerning to me, because if we ever have to do a survey again, I want the parents and the families to know that they have the trust and confidence in us that we're listening to them, but I feel like your recommendation isn't really listening to them. And this is where I go back, I have respect for you, so this is not an attack, okay.
So, first of all, I appreciate the question. I don't appreciate the last statement,
Okay,
which is that your claim or that I'm not listening to families,
okay,
okay?
I apologize.
Listening to folks doesn't mean you always do what they ask you to do.
Okay,
Okay, as leaders, we understand that, okay? As I said in the very beginning, I don't look at this, and I hope you don't look at this survey as a vote. Surveys are not votes.
right,
okay? There's only one body that takes a vote on this, and that's the seven of you, okay? So I take into the health data, the data, everything I showed you tonight, the wastewater data as a tool, the data around what's happened after vacations, okay? And also the survey data, all those pieces. I also take into effect, where our staff is, where our principal, what we can actually get done. Again, I'm saying very clearly, I would love to require that everyone who comes back after a positive case of COVID is required to mask for 5 days, okay? That's what I'd like to do. But I know that it's no way for us really, for our staff to enforce that well, okay? So I make choices based on not only the data we have, but also what we can actually do well, okay? And I think we can do this better for families and for staff and for students by 5 days. Essentially, it's 5 days of school, right? Not a long time. I do want to look at the data again, because you brought it up. Let's just show it on the screen so everyone can see it, about when to start this. There we go. Okay. So it's actually quite varied, because if you look at staff, it's very clear that the largest number of them are the latest date, okay? And then 30%, so a third of families are also on the latest date, all right? Now, you're right, for families of UTHS students, about 50%, the more than 50% want to start as soon as possible. So this isn't one direction, okay? It's quite varied, actually. So that's one piece of the puzzle, okay? And it's and also I would say again, just reiterate that you have to take this into account, okay? And I think I've described all the different pieces about how to do this well. My recommendation to you is how we can do this the best, considering all the information, all the data, and the wide range of sentiment, but also what I think we can do well. That's what it helps.
It does, thank you.
Yeah, I'm struggling with the idea that we need to communicate anything. If it's going to be, if we decide to lift the mandate and make masking optional, if a student comes to school with a mask or not, I don't understand what we need to communicate. I mean, we got a lot of people on the line here. What do we have to prepare for if we choose the 28th or the 7th? What are you concerned about as far as messaging or preparing school or staff, if essentially we're in an optional situation?
So I appreciate your confidence in that folks are paying attention. A small fraction of folks are watching tonight. Even 200 is a small fraction of the folks we serve. So that's one piece. The other piece is very, very seriously, I'm concerned about how we respond to differences. And a difference that we're going to create in our schools is that folks are going to make different choices about this, okay? And in order to, listen, it's one of the concerns that have come up again and again, both in our survey data, as you've read, but also in conversations among superintendents and conversations among staff and our principals, is how do we make sure that anybody who chooses to make this, which will be probably, as we see a smaller number, a minority of folks, how do we make sure that that they know it's okay for them to make that decision? That takes communication and messaging and reminders. That takes direction from me, and not for and also to make clear what we should be doing. So I don't ever underestimate. And I think it's very classic for folks to underestimate the amount of communication you need to do around a change. This is probably the biggest single change that we've had in terms of COVID since we went back to school in 2020. So maybe a small change for yourself and your family, but I think the data shows us that it's a big change for many people, for a significant enough folks in our district, in our community, that giving folks a chance to grow accustomed to it, focus on more data, so it doesn't harm anyone. And it's not like I'm recommending a significant difference. I think it's a difference that's helpful and worthwhile, but it's not delaying it for a long amount of time.
Yeah, we're already in a optional position citywide. It's just the remainder of the buildings. We've sent out the surveys. Everyone's been alerted that it's a possibility.
I just want to be clear. You don't, I'm happy to explain my thinking,
Yes, yes.
but you don't need to convince me.
Yeah.
You guys need to, at some point, it might be, at some point to have deliberations or.
Yeah, and we definitely have a lot of people, so if you have questions that need to be answered as opposed to justification, right? Like that's the superintendent.
Yeah,
I
I was just trying to understand what, he said communicate, and I just wanted to know what that communication is.
Great. Okay, so seeing no more questions, Max and Joe and Dr. Kaplan, you are welcome to stay if you'd like, but we will be taking oral communication now. If you want to listen to it, you're welcome. If you have other things to do, we understand that as well. And we
Thank you very much.
Thank you.
Good luck, folks. It's
you
not
very
easy
much.
work, but we appreciate your doing it.
Exactly.
Thank you.
Thank you.
Okay, so we will move on to oral communications on this topic. I know there's been a lot of information shared. I just want to acknowledge that we've gotten over 130 very thoughtful emails sent to us from parents and from students and teachers, and we appreciate every one of them. I know we take the input very seriously. As a matter of procedure, I, as chair, have been acknowledging every email to thank people for taking the time to write to us, but please know that everybody else here, we didn't think everybody needed 7 responses, but please know that, I am thanking you on behalf of the committee because that's the decision and discussion we had. And everybody's welcome to reply to other people, but please don't take their lack of reply as disinterest, because they are just as interested as any of us who do reply to your emails. So we are going to begin with comments, and we have students here from Gloucester High School who came in person, and we're delighted to have you in person, and we would love to hear from you first.
All right. So first off, thank you for allowing us to come in person. I think that it's a great opportunity that we have to be able to voice our opinion, especially as students, because sometimes students don't feel like they're heard. And frankly, we're the ones that are the subject of this whole thing. Like, the decision is being made on our experience at school. And personally, I'm taking the position that I think that not masks should be gone, but it should be optional. And I feel like that's something that needs to be stressed. That's not getting rid of masks, is that it's optional, and that people can have the choice whether or not to wear it. And a lot of what I'm about to say is just going to be reiterations of what has already been said. But also, I believe that there should be a buffer of 1 to 2 weeks to not ensure for everyone, but to make people feel a little bit more confident that going maskless or having the option of masks is a good choice, especially coming right out of break. Like, there's going to be students and families who are traveling, like either out of state, possibly out of country, who knows? So having that buffer of 1 to 2 weeks is going to be what gives us a look at how things are going. Like, there's been either a large rise or a small rise after many of the previous vacations. So if we have that buffer, just work in our favor. Also about the elementary schools, like, I'm not just saying about high school or O'Malley, but the little kids, it's so important for them to learn without masks, because I know that everyone in the high school in O'Malley, we got that. We got to learn facial expressions. We got to learn how to speak and use the English language with vowels and consonants. Like, in order to learn that stuff, you kind of need to see what's being said. And then on the social part of it, I know little kids are struggling because they haven't, if they tell a joke, they can't tell if their friends are laughing or have no response or not. It's just a connectivity between peers and teachers that is kind of just needed when you're trying to learn those social skills. when you're first making friends. And before I clock out for now, I have one final thing, and my piece of input is a question for everyone that's listening. The question is, if not now, then when? With the warmer weather approaching us, hopefully, and the number of cases falling, now appears to be the perfect time to move forward in our journey of returning to a somewhat normal life. Like, we can't hide and avoid normalcy forever, and it's not guaranteed that we're ever going to return back to life before COVID, even though that would be a dream for most of us. Like, we can't hide from it forever. And in our journey to the most normal life that we can get, we have to make advancements. We can't just sit in the same position. Thank you guys all again for letting me be here, for letting me speak, for giving you not the student body's opinion, because many people have many varied opinions, but at least letting me speak about what I think. I hope you consider what I have to say, what everyone else has to say, when you make the decision for Gloucester Public School System. Thank you.
Thank you. Who else?
She speaks so loud.
Not the whole student body, but for these two.
Nicholas Berlin has nothing to say. Wonderful. We did get your very, very well-written letter. Thank you very much. So we do know that you have thoughts of your own as well, even though they're consistent. Okay, thank you. Okay, so we will, we have so far 4 hands up. So we will begin with, oh, we have more. Okay. Cynthia Mikowski, please. You can unmute, and it's nice to hear from you.
Hello, thank you. Cynthia Mahowski, and I'm a teacher at Gloucester High School as well as a resident of Gloucester. Thank you all for everything. And Jenna, really great job. Makes me extra proud. You let me be on your volleyball team. Pre-COVID. Anyhow, so I just want to thank everybody. I think the thing that my biggest concern was about it seemed very rushed for the decision, right? Like the Commissioner of Education announcing February 28th. It doesn't give a whole lot of time for people to really be thoughtful and plan about rollouts, about what the superintendent had said, about what Jeff Parko had said with their expertise in terms of communication, about to do with families. So I personally would like to wait till March 14th. If it could be even a little longer, I don't see that as an issue because students will know it's going to be lifted and become optional. I think then we'll be able to open the windows and have better air. Right now, our ventilation system isn't great. Like some are freezing, some are this, and those are ongoing issues. The concern I also had was our state house is open to the public. Massachusetts State House, where Charlie Baker works, as we know, opens February 22nd. That's the first time open to the public since March of 2020. And even there, they are mandating mask wearing as well as proof of vaccination or a negative test. And I think if our state house leaders can't do what they're expecting our young people to do, I find that problematic. But I also think that there's something to be considered with allowing waiting for the mask to be lifted, waiting until the 14th, maybe even a week later than that, but at least the 2 weeks, because the data in the previous years have shown that 2-week time period is important. But I think it also can have an idea for people to consider that for parents who are choosing not to have their children vaccinated, that could be a discussion for schools to roll out, maybe that parents who choose to send their kids to school unvaccinated, we also have them with more testing, required testing, because if we're taking away one of the tools that keeps the rest of us safe, those of us here in the Commonwealth, right? It's a shared experience where we're working for the good of all, the Commonwealth, as I'm saying, sorry. It's 9 o'clock and I'm getting tired, as I'm sure all of you are. But I think that can be something to discuss as well. And just having that time where the masks may stay on a little longer gives it, that time is something that we do have. A bazillion years ago, I actually did run the Boston Marathon. I ran it for charity. It took me almost 6 hours to do. When I was in that last mile, I was exhausted. I wanted to give up. I couldn't believe it felt like forever. And that last mile seems the longest, most arduous thing ever. But you know what? If you can just hold out, you can make it through the finish line. There's no rush at that point. So why not take the greatest tool that we have, which is time, to be thoughtful and mindful to make sure we're keeping everybody physically safe. Thank you so much. I appreciate everybody's time.
Okay, Cynthia, thank you. I'm going to read the guidelines of oral communication, which I should have done to begin with, just so everybody has same expectations. The public shall have the opportunity at every regular school committee meeting to be heard under oral communications. Oral communication shall allow any resident who has a request or complaint of any nature relative to the school committee business to appear before the school committee, state their problem without debate, and the matter may be referred to the proper subcommittee. For items on the agenda, members of the public may address the committee with permission from the chair, which is what we're doing. Persons speaking under oral communication shall be limited to 3 minutes each and shall submit a copy of their prepared communications to the recording secretary. The school committee chair shall not allow complaints as to individual performance or character. Okay, and in the interest of the time of night, we are going to stick with the time limit for the speakers. So I will give you a hand when you are approaching 3 minutes. Okay, Graziella Peoni is next. State your name and address for the record, please.
Can you hear me?
Yes.
Hi, my name is Graziella Peoni, and I live on 4 Cedarwood Road. I'm speaking tonight as a concerned parent of 2 high school students, Dominic 10th grade, Ava in the 9th grade. I'm in favor of lifting the mask mandate specifically on February 28th. Masks are not effective nor safe for our children. I know that there's talk of waiting, as I've been sitting here listening, sort of in agony, but the cases are going to rise regardless. They rose when the masks were on, and they're going to rise with the masks off. We need to keep moving forward. Gloucester Public School was recognized as pioneers in 2020 for getting our kids back to school safe. We did it, while our neighboring communities were still teaching and learning remotely. Look how far we've come. Now it's time to continue to follow the data, the governor's decision, and the DESE guidelines, like all of our neighboring.
Graziella, we lost you.
Mask. Several others are voting tonight, as we are. We're living through uncertain times, and I understand everybody's point of view. And I've obviously heard the opposing side, but those that are against lifting the masks still have the right to continue to wear the masks. We all deserve the right to choose. Lastly, I believe Governor Baker would not have lifted the mask mandate for the entire state had he thought it was unsafe. Let's follow his footsteps and move forward to some sort of normalcy for our children. They deserve it. And unfortunately, usually pre-COVID, anytime I would speak about something I was passionate about, I would look to the rest of the room for those parents that don't have a voice like I do, and say, for those of you in favor and agreeing with what I just said, please stand. So I encourage all of you parents that are so nervous sitting here on your phones or on your computer to just say you're against it or you're for it. Use your voice. Our kids deserve it. And that's it. Thank you guys for all your hard work.
Thank you, Graziella.
Thank you.
Okay, next, Cynthia Kearney.
Hi, thank you very much. I appreciate the opportunity to speak tonight. And before you make your vote, I just wanted to present you with some more data because you haven't had enough this evening. We did our own poll of GTA members, and as you are very well aware, the GTA teachers are the frontline workers who have made the success of Gloucester Public Schools the last 2 years possible. They are there every single day. So I wanted to share our data because a lot of times our data is quite different than what the district will present. Not that the district is not presenting correctly, but sometimes staff will give their opinions a little differently depending on who they're speaking to. At any rate, that being said, our data is actually pretty close to what Superintendent Lummis had presented. We polled our membership and we've got about a 2/3 response. Of those 2/3, we are divided pretty much right down the middle, and slightly more to the please do not lift the mask mandate by about 4%. However, of those who do want the masks lifted, we have 50 out of 94 comments stating that they would like it delayed, only because we've seen surges happen before, after breaks. We've seen it happen before coming out of breaks, vacations, and because people are traveling. And we want to try and avoid that. To delay a couple weeks is only going to help keep people safe. Additionally, and that's on both, I should have said it's on both the yes and the no's. So people who don't want it lifted are also saying it's too soon. So generally speaking, our membership just wants to wait and see what happens after the break. We have many more people saying that they think it's optional, which goes with DESE regulations. So by saying this, I just hope you'll take this into consideration, that we are right down the middle on the yes and no's, but we're very unified in saying that we would like it delayed. I hope this helps, and I hope this contributes to your decision. Thank you very much for allowing me to speak.
Sure. Thank you, Cynthia. Very thoughtful.
Thank you.
Next speaker, A. Krantz. There's no last name. That's your last name.
Hello, Olaf Apperens, 47 Centennial Avenue. I'll be very brief. I've submitted some email comments, and I will state on the record, I wholeheartedly agree with everything Graziella Peony just said. The mask mandates need to be lifted as soon as possible. I have very young children. 1 week in a young child's life means a lot more to ours. As far as if you are concerned about that being too quick, it's an optional mask, so you can wear that mask for those extra week or two. As far as the data, I was going through it, and forgive me, I only have a picture of the February vacation. This is not a statistically significant sample to warrant any delay in the mandate. You're talking the week before February 2021, 9 cases. And then the week after, when they returned 11, that's only 2 extra cases. And then you fast forward 2 extra weeks, which isn't highlighted, that's 17 cases. So if you brought this to a statistician or any scientist, this doesn't tell you anything. This is just used as, it's not scientific. And so, and I would hope that some people on this committee would realize that. And so I think right now you're just asking about delaying this masking, but lifting the mask mandate, but there's no reason to. And these numbers don't tell you anything. I mean, look at the week of March 24th, 21. There's 17 cases, more than the 2 weeks after February vacation. And I will tell you this, we were one of those cases the week returning from February vacation 2021. And the reason we became one of those cases because we got a phone call during February vacation saying that our daughter was exposed to COVID right before February vacation. So these numbers don't mean anything. And it's not justification for delaying this, lifting the mask mandate any further. Thank you very much.
Thank you. Next speaker, Matthew Doherty.
Hello, everyone. Can you hear me?
Yes.
Okay, thanks for hearing me. I think you guys all know my position on the subject, but I do agree with Superintendent Loomis about lifting the mask mandate on March 7th. I wish it could be earlier, but I'll take what I can get. Hopefully we can get to a place where we're not looking at cases anymore. So I'll make it quick. That's it. Thank you. Thanks, guys.
Thank you very much.
Thank you.
Hey, Sarah Lovegreen, you can unmute and speak.
Unmute. Hi, can you hear me now?
Yes.
I would like to first and foremost throw my support by Mr. Loomis's recommendation on number 6, that he or our educators can make fast decisions if we need to re-implement mask mandates in specific situations. I think it's important for them to be able to make quick decisions if we are to lift it and re-implement it. As to the week, that seems to be a contentious point. I think that for our kids, if you're a parent and an educator, you know, the day after break, they're all bonkers. If we can just have a week to get back into the rhythm of things and have parents have a chance to translate, and educators chance to translate things into 7 different languages and present it to the community and get the kids back into the rhythm of school and then move forward with removing it, that would be helpful. I feel like that's what the teachers are saying. I think we need to give our teachers, our principals, our superintendents the power to keep our children safe with the changing demographics while also responding to what's happening nationally. Thank you.
Thank you very much.
Thank you, Sarah.
Michelle Bailey.
Hi, thank you, Michelle Bailey. 2 Remington Road. I actually live in Wenham, but I teach at the O'Malley Middle School. And I wanted to say to Superintendent Loomis's point about needing time to get students sort of in the mind frame of acceptance. At O'Malley, we have the sales values, and our second one is acceptance. In the month of March, we'll be focusing on that. And I do think that between now and Friday is not enough time for us to focus on acceptance of people who are wearing masks and people who are not wearing masks. And I personally would very much appreciate an extra week to have those kinds of discussions with our students in our classrooms. And I'd actually more so prefer to have 2 weeks. So I would ask that you either support Superintendent Loomis's recommendation or delay until the Friday of that week, which I believe is the 11th. By doing it on a Friday, it gives us a chance to try it out, have the weekend to recover and go back. I also recommend that you do allow the superintendent to make quick emergency decisions as needed. And then I did want to just say I appreciated Member Watson's comments about, we can't attribute mental health to the masks. I do think that the masks represent the pandemic and are reminders of that we're still living in a stressful time. So I do support that we should try removing the masks. I just really hope that you will consider that we need time to prepare students, and between now and Friday is not enough time. Thank you.
Thank you, Michelle. Next person, Amber McGlynn.
Hi, my name is Amber McGlynn. I am a high school teacher at, obviously, Gloucester High School. And I would like to also support Superintendent Loomis about the March 7th date. I personally think that February 28th is too soon. Considering, I know that some people think that the statistics going right after February break are small, but after the last break, it was so high. And I know at the high school, we had so many teachers and so many students absent. I just don't want, and I don't think anybody wants to risk that happening again, and then have it be even worse if people are unmasked. So giving us that little buffer time of being able to do our pool testing And then on top of that, I do think that when you were all briefly talking about talking to the students and preparing them to, not wear masks, I think that, we're coming up on Friday. We're not going to be able to have a big discussion with the students if we return on the 28th and we tell them, hey, this is coming up. I have a lot of students who still currently double mask because they are so anxious about getting, getting the virus or becoming positive, and they have people at home, and we all know those situations, but they're going to need some days or some time to be talked to. Right before Christmas and right after Christmas, I had parents emailing me saying that they're holding their kids back from school. They're not sending them because they're afraid that they are going to, catch COVID. And I think that might be something that you should consider. If we make this decision right now to send this, right on the 28th and to go back to school without masks, how many parents are going to email saying they don't feel comfortable sending their students, and they're going to miss a week or more of school because that's what happened in December and January. And I think this is too fast of a decision. And then last thing, I agree with the March 7th thing. I do think that it would be better to wait a little longer, but I know that people are very anxious. So when we decided the hybrid remote thing, largely your influence and decision was made on the parents, and I understand that, and not on how the staff felt. Now, the staff poll that you got was about 50% was the 28th, 50% was in the 14th. It'd be really great, and I understand not many numbers for staff, student, or families were for the 7th, but it would be really great if we just met in the middle, right? We could get some data the week before the 7th, see that data, and relieve people's anxieties at least a little bit before we go back. Okay, that's all I wanted to say. Thank you very much.
Thank you, Amber.
Thank you.
Amy Orlando?
Hi, Amy Orlando, 22 Acacia Street. Thank you for taking the time to hear community comments tonight. I do agree with the superintendent that March 7th would be the perfect date to make the mask mandate optional. As an elementary teacher in a neighboring district, I feel that it is important to help students understand that we all have different beliefs and that whatever we and our families feel is the right decision will be accepted by all in the community. It's important for students, especially our young students, to have the opportunity to talk as a classroom community and develop the acceptance for all, no matter what their decision. Understandably, with cheaper flights, some families may have already left for break, and their children are an important piece to the classroom community. 2 days before break is not the time to have a closed community meeting with your own class and to make these important discussions happen. So I'm hoping that you will think about not having the mask mandate be lifted by the February 28th date. Thank you.
Thank you, Amy. Joanne?
Hi, good evening. Thank you for listening.
Joanne, can we have your name and address? I think you blanked out.
We can't hear you.
Joanne, we can't hear you. Okay, Joanne, we'll go to the next person and you can try again, okay? We'll come back to you. Corey Pinkham, please.
Yes, can you hear me?
Yes.
Yes, my name's Corey Pinkham. I live in Gloucester, Massachusetts, and I have 2 kids in the Plum Cove Elementary School. And I fully support removing the mask mandate as soon as possible. My opinion is that we can't sit here and listen to the state and the recommendations of Charlie Baker for everything they say throughout this COVID pandemic and not listen to them now when they tell us it's time to remove the masks. On the way home, my son's 8 years old, listening to this conversation, heard someone say that we haven't had enough time. And his response was, I've been wearing a mask for 3 years. How has this not been enough time? Everyone will have the option to wear their masks, and I respect the difference of opinions. I respect the work that this committee has done during COVID, but it's time to give our students some sense of normalcy and let them remove the masks. Thank you.
Thank you, Corey. Okay, thank you, Corey. We'll go back to Joanne.
Hello?
Yes.
Hi, can you hear me?
We can, yes.
Hi, thank you for letting me share my thoughts. My name is Joanne Moore. I live at 1 Taylor Street. I'm also a reading and math interventionist for the Plum School of Elementary School. Personally, I am not in favor of pushing the mask out. I think that we should be able to have the choice effective February 28th. I think a lot of us are just tired of being and living around statistics, and we can't continue to do this. I'm also the mother of a senior in high school who has a lot of friends who also are saying they're sick of wearing the mask. They don't want to go to school anymore because they have to wear the mask. They're tired of it. I think it should be an option. I also feel that in my position, my students need to be able to see what I'm saying vocally with my lips so they can understand what I'm trying to have them enunciate, and they can't do that now. They also get very upset because we have to continuously ask them what they're saying because the muffledness of the masks. So therefore, they don't want to participate because they feel like they're getting things wrong and they don't want to get them wrong. So now that they don't have enough self-confidence of themselves, I don't think pushing any mask mandate out any further is going to change anything. Parents and students have made their decisions by now on whether they're going to be vaccinated or not. And I don't think that that's going to make a difference. So I am in favor of lifting it immediately as we did for a town overnight, and nobody seemed to have a problem with that. So why don't we do what our surrounding communities are doing? Trust the governor, trust the DESE, and trust the health organizations. And let's make this mask optional, effective immediately. Thank you very much.
Thank you, Joanne. Okay, I do not see any other hands raised. Oh, one. Erin McKay, you may speak.
Thank you. Can you hear me?
Yes.
Yes, thank you. I'm speaking as a parent of high schoolers and an elementary student. So I have my high schoolers listening into this, like February 28th, let's go. They've also shared with us the emotions that they've heard at school this week of both sides, kids who want masks and kids who don't. And it feels like time for conversation around that is necessary for older kids. Because there were some emotionally charged conversations this week before this decision was even made. As a parent of an elementary student, I truly wish that the numbers were a little higher for vaccination. Therefore, I would greatly appreciate that pooled testing and that take-home testing the first week so that those kids, if they returned from Disney with COVID, we know that and they've left school to heal while masks are still on. In our experience in the elementary school, there have been days when there's COVID in the classroom and third graders love to wrestle and be near each other. I know distancing is hard, and we haven't seen that spread pre-vaccination when kids were wearing masks. So I would appreciate that week. I don't know if we're allowed to ask questions of the committee, but thank you, Jeff Parko, for all you've done. Thank you for your insight tonight. But do you see a pattern between people who choose to do pooled testing or take-home testing and people who vaccinate? I'm just wondering, is it all the vaccinated kids from testing? Thank you.
Thank you, Erin. And your puppy too. I don't know, do we want to?
We can answer any questions afterward.
Okay, we'll answer questions at the, afterwards. Okay, next person is Kat.
Hi there, can you hear me?
Yes.
Hi, my name is Kat Pierce of 126 Maplewood Avenue. I just want to thank you for taking the time to hear all of our concerns for our children. I have 2 children in Plum Cove Elementary School. I am not in favor for pushing the mask out. I think that we are all tired of hearing, the same situation here, especially where Governor Baker has dropped the mandate. At this point, I think it's important for children of all ages to receive their childhood back to a certain extent. They have all complied with what we've been asking them to do. I think that, again, it's important to just kind of implement exercise, staying healthy, washing our hands, things that we, basically know and have told, our children what to do throughout this time. Never once throughout this period did I ever have like an aha moment where I was thinking, my husband and I need to kind of implement something different. I think that being healthy, exercising, using food as medicine, and just being aware of what is actually happening in today's world just needs to be addressed. No one really has talked about health, diet, food, just being healthy, and how that can help contribute to helping fight any type of virus, whether it be the flu, a common cold, or COVID. So I think that we need to advocate a little bit more for our children in the health department. And at this point in the game, I just feel like there's enough herd immunity between people having COVID, children having COVID, and then children also being vaccinated and parents also being vaccinated with having COVID. And I would just ask that you please just give our children a chance to at least have the mask be optional. And no one will be judged for, wearing it or not. But I think that we need to start teaching our children to just get back to basics and just try to help them live a happy, healthy lifestyle. Thank you for your time.
Thank you very much. Okay, Carrie Morawski.
Can you hear me?
Yes.
Hi, I'm Carrie Morawski. I am a lifelong Gloucester resident. I have 3 children in 3 different public schools in Gloucester. I have one at Veterans, and I have one at O'Malley, and I have one at the high school. I am not for pushing this mask mandate out at all. I work in medical education. My husband's a scientist. We believe in the science. We follow the science. My children are unvaccinated, and they have had COVID twice, both times with very minimal symptoms, thankfully. I also have a terminally ill mother at home who's currently going through chemo. So I understand protecting other people. And I believe that it's our job as parents to teach kindness and respect and acceptance at home. I also believe, similar to what Kat was saying, teach them that exercise and vitamins and eating healthy and washing your hands and being respectful of others' private space, their personal space, is huge. I have a 2nd grader who had all he knows is masks. He said to me, we were talking about masks yesterday, and he said to me, "Mama, I like my mask. I'm going to still wear my mask." Okay, buddy, you do that. If he wants to wear his mask, I'm not going to make him or force him to remove his mask. On the other hand, I have a daughter who's a sophomore in high school who's an athlete. She goes to practice masked. She goes to competitions masked. It's not fun for her. I have a middle school son who has severe asthma, who takes 5 medications a day to breathe since he was 3. He has to take mask breaks. He was full remote for 18 months due to COVID. And I finally had to introduce him back into society. And I was nervous as a parent. I think our kids deserve better. And I think we, as an amazing community that we are, can do better. I think that all of us parents, we do the best job that we can, and we can teach our children. Not everyone's going to remove their masks. Some people may wear 2 masks. That's fine. My mother will continue to wear a mask. My mother doesn't leave the house right now, but when she does, she will remove her mask because that is her choice. And I think, well, let me just back up. I just want to thank you all for hearing me, and thank you for everything that you do. It's been a long time, and these kids are ready to get back to normal life. I've seen it. I've seen my daughter get severely depressed and lock herself in her room and not want to leave the house. And it was hard. And I see my 7-year-old who's severely dyslexic. He can't read his teacher's lips. The day that he can read his teacher's lips is going to be a breakthrough day for me, for us as a family. And again, I think all of us, by pushing it out and pushing it out and pushing it out and saying, we'll talk about it in school. That's our job as parents. We will teach them, respect your peers, respect your teachers. There's teachers that have illnesses, they have children that have illnesses. Respect your peers.
Carrie, the 3 minutes is up.
Okay.
All right, thank you very much. Stephanie Silva.
Sorry, I just hit something. Can you hear me?
Yes.
Hi, I'm Stephanie Silva. I live at 16 Lawndale Circle in Gloucester. And I just wanted to say that I appreciate and I realize how difficult it must be to listen to so many statistics, weigh the pros and cons, and ultimately make a decision on when it's safe for us to take that next step towards normalcy. What we parents are asking of you isn't to make that choice for us. We're asking for you to return that responsibility to the families. Let us decide how and when we start that transition to our new normal. We, their parents and families, know them best. We love them the most and would do anything on earth to keep them safe when and where we need to. Please give this responsibility back to the families and lift the mask mandate. Thanks.
Thank you for speaking. Anyone else? All right, we will close the, Heather Numerosi, under the wire.
Hi, I didn't press unmute. I had more of a question. I did miss some of the discussion earlier about whether or not natural immunity is factored in to the decision. But my question is if the, get out of here. Sorry, they're still up. Is there really a difference between the immunity of an individual who has been vaccinated and somebody who has recent natural immunity? Because I feel if we factored that in at this point in the year, that we'd probably be very close, if not over, the threshold by which the decision is made. So that's all. I did miss some, but it's just a question I had. And I don't feel like it's been discussed that much during this meeting.
Okay.
Thank
very
you.
much. Thank you. Tom? I think you've been unmuted.
Looks like he's muted, yeah. There we go. I'm sorry. I'll just keep this quick. First of all, I'd like to say, personally, I'm looking forward to the lifting of this mask mandate, but I'd also like, as a matter of thoughtfulness, to point out that there's a lot of research that does strongly suggest that there's a difference in schools that have masks versus schools that don't have masks. And in particular, the rate of transmission may be something like 2 to as high as 3.5 times as high for schools that don't use masks. And I guess my point in mentioning that is not that we shouldn't lift the mandate, but that there's a cost of lifting the mandate. And there's a shifting of burdens, if you will, from everyone to those that are most vulnerable. And I hope that as a community and as a school system, we continue to be mindful, not just of the students that have to wear masks to protect their immunocompromised family at home, but also of, the deaths that follow this decision. And again, I'm not trying to be ominous, but just pointing out that transmission will be higher. And I'll also just add that I hope we don't constrain the superintendent in any way from reinforcing masks or requiring masks when it's called for because of a spike. Because I think there are times when good policy means using masks again. So thank you for
Sure,
sharing.
thank you for speaking. Can we have your last name as well?
Weber with 1 B.
Great, thank you.
Thank you.
Okay. I do not see any more hands raised, so Nicholas Coleman wants to speak.
So I was just saying
Close it out.
So from personal experience this week leading up to this meeting, I feel as if the bullying actually has been the opposite. It's the people who I'm concerned that if it does occur, it'll be those who wear masks are calling the people maskless selfish and inconsiderate. I've witnessed that firsthand this week. So when we were congregating this week at school and talking with our classmates, that's why we think the 1 week delay is good, so we can have rational discussions with each other and try to help kids transition and realize that we should respect everyone's personal comfort level and make sure that everyone's opinion is respected.
Thank you. Nate?
Just to piggyback off what he said, I don't think that on the topic of bullying, I don't think any student is malicious enough to bully another student for respecting guidelines, during a global pandemic. However, I do believe that students are not afraid to call out other students who are first to remove their mask or for whatever date you all choose. Obviously, this is my personal opinion, but if we were going to open the conversation about bullying and social issues, we should definitely look at both of those events. Thank you.
Thank you, Nate. Okay. So this will close oral communication and we can move on to our deliberation. So how would the committee like to proceed? Do we want to each express where we're headed so that we can then maybe have someone make a motion, if we can kind of do that without necessarily the whole justification of what our vote might be, but where you might be headed? Would that be helpful to? Okay, Laura, we'll bring with you.
How do you want me to limit it? Just, how do you want it for that?
I guess say what you feel you want to say as to where your gut is on what we want to do, what we should do.
So I have a couple things I want to say. First, just a lot of appreciation to Jeff Parko, the entire nursing staff, and all the COVID, sort of the whole team, which is all the nursing staff, it's many more people. And to the superintendent for this just very informative and very, I think, honest presentation. The 2 points that I want to make are that first and foremost, whatever, and sort of to your points, whatever your feelings are about masking or not masking, like we aren't the enemies of each other. Like we're working together to fight a virus. So I really want to sort of put that front and center, that we may have different opinions, kids may have different opinions, but if we really just keep the focus on the fact that we're all trying to keep our families and our community and our schools safe, I think that'll help us sort of move into this next phase. And we as a school committee are doing, I think, what Ben has said every single day, like every day matters. And to keep our schools open it matters. And I think that's the goal of everyone here, so that kids can be in a safe place and keep learning. And so that's sort of the basis of my motivation tonight. And then the second point I wanted to make is that whatever we do vote tonight, the pandemic's not over. So we're just moving into another phase, and I really hope it's the end phase, but I don't have any confidence. So I really hope that our community can keep doing what we are doing, which means to get vaccinated and to test and to stay home when you have symptoms, for everyone's sake. So those are my main things, and I'm impressed with what Superintendent has recommended, and I think that sounds like a very reasonable path forward.
I too want to just kind of echo what everyone else has said and appreciate the work you've put into this, Ben, and the presentation, all your hard work in collecting that, you and your staff, and certainly appreciate that. I think no matter what we decide today, Laura and I were talking about, I don't even remember when we were talking last night, maybe about the fact that I feel confident that the people on this board are perfectly capable of coming to a decision and that not only are we capable of coming to a decision, but that we're capable of being united in that message coming out of here. And that gives me great comfort. And that shows me or tells me the respect that I have for everybody at this table, that it's not simply me making a decision in a vacuum, which I sometimes like to do. So I probably came in here thinking, well, after reading through the emails, that a little bit of mask fatigue. I understand the parents that certainly want to drop the mask mandate, but I think I've come away with a couple of important questions. And really what it boils down to me is, what is the risk that I'm willing to take for the community, and say, as my vote kind of plays out, and am I willing to say, boy, that's a big risk between the 28th and the 7th. And to me, those are the two dates that kind of resonate with me. And I don't think there's that much of a difference between those two dates. And I'm really just kind of thinking through this as I'm talking, so please excuse me. The other thing that I think is important is that I'm not sure I buy there's not enough time. And I'm not being critical about that. I just think that when I see students at particular schools or at the high school, mask kind of down around their neck, not really wearing the mask the way it's supposed to be properly worn, I'm not so sure that they're that concerned about, that they're still in that I'm concerned mode. So that kind of concerns me a little bit. And then the other thing that I think is important is that we respect that the parents are part of this process, and that sometimes it's easy for me, and not only the parents, but also, and I'm glad that Cynthia came on tonight to kind of express what the results of the teacher survey was. And so I want to make sure that those parents are heard. There's a lot of people that, again, we're not operating in a vacuum. There's a lot of stakeholders, and I just think that certainly not an easy decision, but that's kind of it for the time being.
So similarly, I just want to thank everyone who's taken the time to provide respectful feedback via email, in person, via the survey. It's super helpful. And I want to also thank the teachers and staff for consistently making it a priority to keep our schools open by all means necessary. At the end of the day, that's our job, to provide an education, not to really make public health decisions. I think that's been our goal since the beginning of this pandemic, and we need to keep that in sight at all times. So let me preface my comments by saying that as elected officials, we have a responsibility to our constituents, but as school committee, our main goal during this time, and has been and should always be, to keep our buildings open safely. Sometimes those things might not align completely. And so, we have to sort of piece through, as Ben said, the different pieces of the puzzle, the concerns of our constituents, and also sort of the data to sort of come to a responsible decision. So tonight, I'd be basing my vote regarding public health on public consensus, the decreasing numbers in Gloucester at the moment, and thorough representation by then. So I'm really appreciative of you taking the time to prepare for this, because coming into this, you know, the state gave us really no metrics and or data to base our decision on. So you taking that time, Max, the Board of Health, and our nursing staff really coming together to give us their takeaways, I think probably most important. I also want to say, so as a parent of a 3-year-old who doesn't remember a life before COVID and a kindergartner, I fully understand the notion of feeling done, being tired, overwhelmed by the day-to-day grind of risk assessment, COVID tests, feeling worried about the overall implications of COVID, not just masks on our children. There are days that I feel, honestly, an overwhelming sense of sadness that this is the world all of our children are growing up in. However, there are just as many days, if not more, that I see children thriving despite it all, and I feel in awe of their resilience. And I think it's really important to keep that in mind, that kids have, despite all of this, really continued to do well in difficult situations. So with all that said, I'm in favor of amending our mask policy to reflect public consensus and the decrease in COVID numbers in our community, and in support of Superintendent Lummis's recommendation of March 7th, with emphasis on giving him sort of the authority to implement short-term mask implementation as necessary. So I think that's a really important distinction. The one I just want to close out by saying I discussed this possible transition with a local pediatrician, and his perspective was super helpful. He basically said that the numbers in our community are drastically changing, and our protocols should reflect that, because kids absolutely deserve a break. And so I think that's really important to keep in mind, you know, as these things sort of ebb and flow, by allowing our kids to have a break to reflect sort of the numbers is just a really important perspective as we move into this sort of next phase.
Okay, Melissa?
Okay, so I don't think it's a secret to anybody, at least here at this table, and to the people that I've talked to, about my opinion of masks. And I say that I'm not an anti-masker, but I've long been done with masks months ago. But here we are tonight. And I sit here and my struggle is, first of all, I don't believe that we all need to come out in a consensus, not a consensus, but everyone with the same decision. You know, I believe school committee members have their own reasons for voting the way they do, and that it's not a bad thing if we don't all agree for whatever reason that is. And to have that expectation, I would say that we'd be bobbleheads if we're always saying yes to each other. You know, our opinions matter. People who vote for us want to hear from us. That's why they vote us into this position to be able to make these decisions. So my struggle sitting here tonight is knowing who I am and how I feel about this topic after talking to way too many people, because I've been talking for weeks. My struggle is having how I feel and hearing you ask for help. Because I think we're all pretty much in agreement that mask is coming to an end, but it's a matter of when. So as I sit here, I'm someone who wanted the mask off yesterday. If I didn't have to wait for February 28th, I view my decision through the lens of a lawyer that got out of law school, who focused my studies on parental rights and constitutional law. So I have parental rights and the right of a parent to raise a child the way they want, combined with my education, having personal choices. That's my lens that I see through when I make decisions. And this is not a yes, wear the mask, don't wear the mask. This is a mask choice. So here I am talking about mask choice, thinking about parents' choice, but hearing someone who wants help on a date that I don't necessarily agree with. So that's my struggle tonight. And it's no disrespect to you. Where I'm at right now is I would want them off today if they can be. I think overwhelmingly, I hear the parents We heard Stephanie Silver tonight say, you know, give this right to the parents. It is their child that makes their decision. I heard Deanna Benjamin say at our last meeting, I think it was the last meeting, we were told to put the mask off in a day, we can take them off in a day. So knowing that it's not the mask on and off coming, it's the conversations and the preparation, I think many of us are putting that responsibility on the school where I believe it's in the home. I understand you need time, but I see this as February vacation is coming. We have, 10 days that parents can talk to their kids. These kids are communicating with other kids. They're talking with other kids. They're probably not wearing masks when they're with other kids. Parents have been going skiing out of state on weekends for the past few weeks and traveling. I know people will travel to Florida and come back during school time. I don't have those concerns about masks staying on anymore. I think it's a parent's choice because I know many kids will still wear the mask and should still continue to wear the mask. It comes down to choice. I believe that the kids can come back from February vacation and you can still have the conversations, even though the mask mandate was lifted. There's a lot of work you can do while the masks are coming off if some choose to take them off. And I also think the high school, this is a perfect opportunity to get put in a situation where they can talk about it as it's happening, not necessarily preparing it, because it teaches kids how to cope with things that happen suddenly or 10 days from now, if you want to call that suddenly. So my vote tonight is, and I'm not saying, I'm not trying to persuade anyone differently, but where I'm at, I believe in the parents' rights first. These are good parents talking to us. They're advocating to have their voice be heard and this mask as soon as they can. I do have a big concern, and I mentioned this to Kathy a couple weeks ago when I knew this was coming, is how are we going to enforce after February 28th? You have a lot of parents out there that don't want their kids to wear masks at school. I feel like we're going to be wasting a lot of time and energy trying to enforce the mask mandate if parents send their kids to school without masks on, telling them they don't have to wear it because the state said they didn't have to, the MIA says they don't have to. So I'm more worried that we're spending time on trying to conform to a regulation as opposed to having a discussion as it happens about the mask possibly being removed from some students, but not everyone. So that's what's in my head right now.
I don't know how to start honestly, but there's so much to consider, and the response from the public has been so overwhelming. Just trying to keep up with it is quite a task. And I do commend Superintendent here, Loomis, and his staff for compiling so much information in such a short period of time with such an overwhelming response. And I also am very thankful for the incumbents who are still on the committee that have been dealing with it from the very beginning. And especially, when Sam and Laura were freshmen themselves on the committee. Bill and I are getting thrown into the fire here, and this is a really monumental meeting that we're having right now. So it's a lot to take in, and I have my opinions, and I'm here struggling to keep this mask on while I'm talking. And one of my main considerations is the toolbox we have. I mean, there's a lot of things you put in your presentation about what helps. I mean, I'm sorry, I'm really having trouble when I talk here, but what helps stop transmissions? And I personally think from my own investigations and research that masks are the weakest tool in our toolbox. We have so many more tools than we've had since a year ago. The wastewater analysis is the best data and the best way to see trends that I can think of. The testing that's increased, and there's other things that aren't highlighted and encouraged that I think really should be highlighted. Like, I was listening to Kate and Carrie, and they put the nail right on the head there. It's like, how come we're not talking more about health and ways to combat getting sick with, say, like vitamin D or just losing some weight? that's a primary cause of concern if you get COVID. And there's so many other keys that we can focus on, proper ventilation, just education on hygiene, the vaccinations, and all this other stuff. The Omicron spike, which is a blessing in disguise, where we certainly have a lot more immunity than the vaccination rates would indicate. So that's why I asked a lot about the vaccination rates. Gloucester as a whole is doing better than the majority of the average of Massachusetts as far as vaccination uptake. All these things, I think, for my research, let me just say this one thing. I know I seem to be blathering, but interesting thing I discovered from looking at CDC's website, there are no masks, N95 grade, that are authorized for children. There's no, I forget what the term was, but no certification for children to wear actual masks that do anything more than 30%. The rate I saw of protection on the CDC website was around 30%. And that's if they're used properly, if they're fitted properly, if, say, they're not soiled or wet, and if they're not used for a prolonged period of time. All these ifs, and to get that protection from a mask, I think, is our weakest tool. So I don't see any reason to not expressly remove masks as soon as possible. And I hope everyone else agrees with that.
Okay, Mayor Verga?
Yes. First of all, Ben, thanks to you and your team for putting together the facts for us. It was very useful information. As I mentioned earlier, the Board of Health, they didn't let politics get in the way, even though they were getting some nasty feedback from people over the last several months. They based their decisions on facts. When at the state, they put forward the mask mandate for the schools, it was a tool in the toolbox that had a job to do, and it did the job to the best of its ability. And the job is not done, but it's done for now. I think we need to give Ben that tool to keep in the back of the toolbox if there's a need to bring it back. But as far as the argument about the time needed, and to Melissa's point, they have, this day's almost over because the meeting's gone so long, but there'll be 11 days left. So we're not talking just the 3 days of school. We're talking parents. Ethan Foreman from Gloucester Times is on this meeting. As soon as we finish, there'll be an article in the Gloucester Times. This news will spread mighty fast that the Gloucester School Committee has voted to lift the mask mandate, in my opinion, hopefully as of February 28th. So the word will get out there. Masks work, vaccines work, but we are where we are because people did what they were supposed to do. So it's time to rip off the Band-Aid, as one of the letters we got said, and let people start living. Make it optional. Make sure we have the culture of acceptance that was called out in the governor's original message. But the time has come. I support a motion that includes the February 28th date.
Are we going into deliberation or to discussion? Need a motion first. Then you better start first.
So I'll make my comments. I think there's been really 2 dates during COVID that have been kind of, oh my God, thank goodness. One was when the vaccine was announced that there was a viable vaccine. I can't even tell you how happy that day was. It was like there's light at the end of the tunnel. And the second is this removing masks for our kids in schools, or making them optional. I just know that there are definite, health benefits, and there are definite interferences with just normal interaction with people. And our numbers are much better. And I guess the other thing I felt when Desi said February 28th, I thought, oh my God, what a ridiculous date for them to pick, given that it is the date everybody comes back from the whole state from school vacation, because I think we all tend to have our vacations at the same time. I am hearing from, I am listening to the parents and kids that are not quite ready yet. I think that was kind of my first inclination is just giving people some time to think it through. Also, some consideration for those who really aren't comfortable and seem to be really uncomfortable and don't want them gone during this school year whatsoever. I do, hear the parental choice and personal choice, but I also feel we have a global, but more specifically a community responsibility to try to tread as carefully as we can as we proceed with this. I definitely, don't think, I think masks, it's definitely time to be done with masks, but I hear that, I hear that people want comfort after vacation. I know a lot of people traveling. I don't know anybody traveling. I don't travel anymore, but I would like to. But there are people that are going to be traveling. And I think just like every other time when holidays were coming up, families and kids were kind of staying close to home, and because they knew they were going to see a grandparent. They knew they were going to do, they wanted to be safe and have some control over that. So, I do think that some people just need a little more time with this week after vacation. And I'm hearing loud and clear from Jeff Parko, our head nurse, and the superintendent that, these are kind of some important days. I hear Cynthia Kearney and the teachers, that sways me that, they need to get, thinking about new normal. So I guess if it was the 28th, then it was just the 28th, not the day coming back from vacation, I wouldn't care that it's the 28th. But I do think that impact of vacation, it may have an impact. And if it doesn't have an impact, we all learn something. It's 5 days. I'm really delighted the students have been here and part of this. And if I thought anybody would be impulsively or really losing patience with this whole thing, it would be our students. And I hear patience over there, and I hear some very rational approach to how we get to March 7th together, and with respect and with good conversations and with the ability to celebrate as soon as that last day of the week before March 7th hits. So I'm leaning towards the recommendation by the superintendent. I think it's important he has the ability to pivot on a particular case situation within our schools. I think he needs that authority to do so, just as he has had our kind of trust in terms of how numbers move along in certain situations in our schools. If there's some flare up somewhere, I do think every parent would want us to know we were doing the right thing and we were quick to react and we didn't let it get out of hand. So that's where I'm at. Okay, someone want to make a motion? Yes?
For the sake of time and to get this conversation started, or further the conversation, I am going to make a motion that effective February 28th, that our mask policy is, that masks become optional in the schools. We'll start with that, because I know there's a lot of motions that are going to go forward no matter what decision we make tonight. So I guess my motion is to effective February 28th, that masks become optional in the Gloucester Public Schools.
Second.
Okay, we have a motion and a second. Any discussion on that? Laura?
So one thing I just want to say that was interesting to me, I'm a parent of 2 elementary school kids, and for first graders and even my 3rd grader, like this is what they've known for a long time. And so it was quite clear to me that age group, at least in my experience of that age group, they're crazy coming back from vacation, what Sarah said is true, and also they need to adjust. Like this is a seismic shift in their classrooms, even though they're not wearing their masks all correctly and they're not. What I was really interested in is that you guys, the high schoolers, were also saying, we need a little time here to figure out how we work together on this. I don't have high school age kids, and I didn't have to experience this in high school. So for me, like that was a new piece of information that was really helpful. Parents can talk about this at home, they certainly can. We have no idea, right? Parental choice, right? That's something we want to talk about. So parents can choose how much they want to talk about this and what they want to say about it. But it's going to be our teachers and our staff who are on the ground every day with the choices that are being made in the schools. So from my perspective, like, I hear them loud and clear, and I don't remember the name of the O'Malley teacher who spoke. But, you know, it just sounds to me like we're hearing both from students and from teachers that like, and from the superintendent that, I mean, this is a really seismic shift. Our kids had to change on a dime. Remember one day they just didn't go to school for the next few months. Like this has been a series of shocking events and sudden events. And from my perspective as a parent and as a school committee member, when the educators are telling me and the students are telling me, give us a moment to sort of figure out how we're going to frame this for our students to make this as successful as possible, I take that very seriously. And we want this to succeed, right? We want this moment where we take our masks off to succeed, or we make them optional. We want that to work and not become a source of friction. So that for me is a very important part of my thinking around March 7th, not February 29th.
Sam?
So what I sometimes find really hard is when we sit here as elected officials to sort of really figure out, you know, like essentially who our constituents are, because I feel like we have a responsibility to students, we have a responsibility to staff, we have a responsibility to parents. And so I think we have to sort of consider all of those things and not weigh one more heavily over the other, right? And so I agree with Laura that, you know, it's really the staff that are going to be really teaching these social norms, this sort of shift in social norms on a day-to-day basis. And I think we're making a lot of assumptions that every parent in this district has the ability and the skill set and the resources to really talk about this in sort of an informed way. And we know that a lot of social norms in our district are taught first and foremost by our staff. And so, yes, maybe a lot of the people who are attending this meeting will do just that. They'll go home and they will teach over this February break sort of what is to come. But that is not the case for every student in our district. And so I think we really need to give our staff the respect that they deserve to be able to teach the social norms that are going to be happening in their classroom. These social norms are not going to be, you know, this change is not happening within the home. This is happening within a classroom. And so the staff really needs to be, we need to listen to the staff just as much as we're listening to our parents.
Quickly, I'm a little bit concerned that what we're saying is it can't work on the 28th. Like there's just too many barriers to the 28th. And I just don't, when I look at myself, I say, I just don't believe that. In my core, I don't believe that it can't work on the 28th. And I think that if I walk out of here tonight and I say to myself, well, the 28th, it was not enough time. I feel like I'm not being true to myself and how I truly feel about it. I also don't assume that parents know how to talk to their kids about it. I probably say most of them don't, and most of them don't know how to talk about it. And that gap gets filled by either, you know, educators or people that kids are connected to. I've kind of come down on the side of I want to give the kids a chance to say, we can handle this. We'll be all right. And if the rest of us are trailing behind that, then so be it. It's kind of where I'm at with it. So respectfully, I certainly respect my colleagues on the school committee, but that's kind of where I'm at with it. So.
Melissa?
We did hear from students tonight here, and we did hear from students through the survey, and we did hear from students through our emails. So I'm not looking at what just happened tonight with who's on the screen and who's watching. I'm looking at the big picture and all the communications that have come forward. And I strongly believe that parents want their masks off. And most didn't even realize that we would come down to us considering a date as opposed to them staying on mandatory on or off. I think most parents thought they were advocating to give us a choice and didn't realize we'd be talking about a specific date tonight. But with that being said, through these surveys, I see the eagerness to get the mask off as soon as possible. We surveyed them and we even gave staff and parents and teachers a date that they would recommend, and the majority picked February 28th. I have a lot of confidence that, especially in our superintendent, that when he wants to get a job done, it gets done. I don't like the idea of putting extra pressure on him. That really bothers me. But at the same time, I come back to parental rights, and a parent should be talking to their children. It's not the teacher's responsibility. But as I say that, I know a lot of responsibility does fall on the teacher, and we're grateful that they step up to that role. But parents first, in my opinion, and I believe the time between now and February 28th is adequate for them to be talking about what their kids will be coming back to. And what they're coming back to is no different than what is going on in weekends and what goes on here sometimes at school during sports events. It's not like coming back on February 28th is going to be the first time that our children are exposed to kids that could potentially be unmasked. So I believe that as we're unmasking and that choice happens, we have those conversations at the same time. So that's why I put this motion forward, and I would hope that that would be the vote that comes out of this committee.
I just did some back of the envelope math here, and I have a number of 82%. If you combine all of the three categories, staff, families, and GHS, and run the percentages for each of those populations, and then 82% suggest February 28th. You know, statistics, you can I did commend your staff for putting together these numbers and stuff, but what struck me was there wasn't a combined answer to what dates were preferred, combined for staff, families, and GHS. If my math is correct, 82% suggest February 28th.
Are you saying 51% students, 54%?
So I took the numbers.
Oh, I hear you. Okay, yeah, I was trying to say.
And I understand there are a lot of concerns. It's been a very fearful time. I went through my own period of being afraid. I've come out the other side. A lot of people are still afraid, and we have to be respectful for that. I understand that. A week is, a vacation. These kids are going to be exposed to a lot of people not wearing masks. It's been lifted citywide and in a lot of cities. Not everybody's going away. Parents will have time on vacation to talk about it. And we have to give parents more credit. I give teachers a lot of credit too. They are a vital link to the upbringing of our kids, and we rely on them a lot. But we also have to give a chance for the parents to speak about this.
I want to say one small. Go ahead, Laura. Just one point, because we talked a bunch about Massachusetts lifting the mask mandate for the state, except if you read it, they actually say if you're unvaccinated, you should remain masked. So that's actually what the state has said for the state, for the indoor mask mandate. That's what it says. I just want to compare apples to apples. Like, a lot of our kids are doing a lot of different things, right? Plenty of kids are out doing tons of things unmasked all the time. And plenty of our kids are not. Like, I really want everyone to understand there's a lot of differences in how people are handling this and how families are handling this, which I think we see in these surveys. And just because you stay in Massachusetts doesn't mean you're masked or unmasked, like, there's just a wide variety. So just to be very clear that that's what's happening.
I just want to say something also, a little follow on, as we're trying to compare, the city saying you don't have to wear a mask inside versus us with kids coming back from vacation who are sitting next to their peers for 6 hours a day. If they come back, as I say, if this February 28th was any other Monday, I would feel exactly like you feel. I just like that buffer, and I hear parents being concerned that people will, if they do come back, there's going to be a lot more people impacted without a mask on, and I just think the safe, I'd rather be more cautious about it. Go ahead, Melissa.
I'm not.
Go ahead. No, it's okay.
So I just want to be clear that in my position as I'm making this vote, because Laura brought up, there are recommendations in place, and I strongly recommend that those who are unvaccinated still wear a mask. I don't want my vote or my position to sound like that I'm saying you shouldn't wear a mask ever, because that's not where I am. I 100% support a parent's right to mask their child when they see fit. I 100% support any student, whether they're immune compromised or not, to wear a mask whenever they choose. To me, this is purely about choice. If we lift this mandate on the 28th, everyone has a choice. You have a choice to wear it, you have a choice not to wear it. And that is a parental right that I believe should be in effect as soon as possible, knowing the state now has recommendations that people should follow, but yet not a mandate, because they have spoken to experts. And I looked today on the Boston Board of Health or Public Health, and they do have mental health specialists, so I have to believe that those conversations were taking place. I am someone that does take the position that wearing a mask is causing issues. I see it in my family. I see it with kids with anxiety that hide behind a mask now. So in my opinion, just want to be clear, this is about choice. Both sides have a choice as of February 28th, and those choices have to be respected and move forward. I just wanted to be clear with Laura, because you're right, there are recommendations out there and they should be in place. Go ahead.
Last comment for me, Madam Chair. I totally agree, and I totally support all the recommendations that Ben has put forth, except my big thing is the date, the 28th seems right to me. I also strongly support the message of it simply won't be tolerated in the Gloucester Public Schools if you bully anybody or you put anybody in a compromising position, with regards to their desire to wear a mask. Or not, exactly. And I think that, that's on the community as a whole to kind of tackle that. I feel very, very strongly about it.
Last comment from me. Bullying is never acceptable. I don't think that's going to change. And all of a sudden I lost my train of thought. But I just want to reiterate that we're only taking away one tool, actually making it optional. We're only removing one tool from the toolbox. And like I tried to say before, it is the most ineffective tool I think we have. I honestly think as far as kids go. Adults, it's a different story. You have a choice to wear an N95. It's not effective. It doesn't fit a child's face. It's not approved for that. I just want to reiterate that.
Sam? So you're absolutely right that we have lots of other tools, but we also have to look at our enrollment rate and on whether or not people are actually accessing those tools. I'm sorry?
I said we're choosing.
Yeah, and I think,
and I don't mean that sarcastic, I just meant.
I think, what we're encouraging is people to, if we're going to take away masks, right, or make it optional, to access other tools. Right now, we don't have 100% enrollment in using other tools. And so as I'm making this vote, there's hesitation, right? If we were at 100% pool test, everybody in our schools were doing pool testing, I might feel a little bit differently about it, but that's not the case. So, we still have a responsibility, right, to continue to talk about the importance of using all of those tools, especially as we lift this mandate.
Yes.
And that's, our community is not behind that yet. Like, we are not there. And so I think it's important to keep that in mind and keep that perspective, because there's other communities who are at 90% enrollment in pool testing. We are not.
Vaccination.
And vaccination. That is not our community. And so we are sort of thinking about this, at least I'm thinking about this with all of that data in mind. And I think it's important to continue to keep that into perspective, because our community is not accessing every tool.
I think there's just other tools that I wanted, sorry.
Well, I just want to sort of follow up on what Samantha's saying, because, exactly, people choose whether they vaccinate, they choose if they want to participate in pool testing, they choose if they want to participate in home testing. And even, health and immunity, like, these are not things in our jurisdiction. We do not have that role in this community. The things that the state has mandated are the tool in the toolbox that they can mandate. No other tools. And as Samantha said, our rates are lower than surrounding towns on some of these things, on many of these things. So, if we do have other tools, I wish people were accessing these tools. I still wish they were. I know people have a variety of different reasons for not accessing them, and they have that right. But given that they're not accessing other tools, this is one thing we have. I just also want to say, just as a point of fact, there may not be masks that are certified by the CDC for kids, but there are very high independently tested filtration masks for kids. A lot of kids are wearing them if you're in the schools. So they're tested at that rate.
Does the mayor have?
Yeah, the mayor has his.
Oh, sorry. Sorry, Mayor, your hand wasn't up the last time I looked, and that was not long ago.
To Sam and Laura's points, yes, about the tools and all that other stuff. So on February 28th, we're still not going to have all people utilizing all the tools. We're not going to. The kids are still going to be sitting next to their peers who aren't vaccinated. That's going to be the same on March 7th. It's going to be the same on March 14th. It's going to be the same on June 20th. So whether or not we go with the 28th or March 7th, all those other factors are kind of irrelevant. It's not going to, that 7 days isn't going to make a difference for people to start participating all of a sudden and line their kids up for vaccination or to find better fitting masks. So what's before us now, the question is, are we going to vote for the 28th or not? And if we vote yes, then we move on to the rest of Ben's suggestions. If we vote no, then we have another motion with another date and then take up Ben's suggestions. So I move the question.
Okay, all right. We will take a vote. We'll do it by roll call vote, as always in our meetings, remote meetings.
Ms. Prince.
Yes.
Mayor Verda.
Yes.
Ms. Watson.
No.
Ms. Reason. No. Chairperson Clancy.
No.
Mr. Melvin.
Yes.
And Mr. Minio.
Yay.
So we have a lot of work to do. So the vote passes 4-3. And I just want to be clear that I think there was consensus. We definitely were 1 week away from each other in terms of timing. Everybody was supportive, obviously, of moving to mask optional. We also have a revised policy in front of us, which
I'd like to make a suggestion for next steps while we still have 232 people watching.
Yes.
I know Ben is rightfully concerned about timing and messaging, and I'm wondering if this is an opportunity for you to address and get on record right now of what your concerns would be, or any suggestions for parents talking to their kids during this time, knowing that this is going to happen, if that helps you in any way. I mean, we've heard that you need time, but I don't know exactly what you need.
I'm not sure why the numbers are going down so quickly right now, but it may be because you just invited me to do that.
Friends to get them back on.
Okay.
Could I suggest we just take the action on the the rest of Ben's suggestions first? And,
Okay, great.
or is this policy basically, I don't have the policy open in front of me. Did it plug a date in, or was it pretty much just the points after a date's assumed? I guess we can just make them.
There's no
Okay.
date. There's no date. It's just a change in policy.
Well, if that's the case, I make a motion, we accept the, what's it titled? The policy,
Face coverings file EBCFA.
yes. I make a motion, we accept it as presented.
Wait a second.
Second.
Any discussion?
I just have a question. And well, two things. One, while we still have people on, let's make it clear that whatever we decide, masks are still required on school buses. I know we've said it, but I think that's gonna get very confusing. So that's a federal issue. And then I'm just looking in here. I'm not sure I see where the superintendent's record. I just want to make sure I know where your power to enact.
Fourth paragraph that says there may arise situations.
Okay.
Did we get a second for the motion incidentally?
We did.
We did.
Okay.
You lost 50 people again in the last 2 weeks.
I tried. Maybe it was me. I'm just kidding about that.
Okay. What are we doing?
So I just wanted to be clear on where we were giving them power to enact.
So this is pretty much the same policy, correct?
Yeah, you can, so you can look at, so what you have here, just.
It's not what has
You have your current one on the first page. The second person, and then second page is mine, draft, and information. The third page is where you see the red line.
Right.
So the third page, you can see what is it, you can see what was cut out, go to the third page, you can see what was cut out.
Okay.
Okay. But, yeah.
Oh, I thought it was this one. Would anybody mind if I apologize that out loud?
Sure. Sam's going to read that particular paragraph
And
out
then the
loud
next page,
so
yeah,
that.
this page is, you can see where.
Yeah, the public is also here.
Yeah, I just thought we were working on this one.
Now can see what wasn't.
Yeah, you can see.
Same kind of,
yeah.
Okay, Sam, you want to
It's
read
red
that
line.
paragraph?
So I'm just gonna read the paragraph in which we're giving the superintendent discretion, thank you, to implement short-term mask wearing. So there may arise situations where, to protect against a further increase in COVID cases and or in-school transmission, it will be necessary to require masks or face coverings for a short-term, time-limited period for a specific class, classes, a grade, or a school. At these times, the superintendent, after consulting with the Gloucester Department of Health, the head nurse, principals, and DESE, may require masks for a time-limited period for a class, classes, a grade level, or a school. Any institution of district-wide requirement for masks or face coverings would be brought to the school committee for consideration and an official vote of the committee sitting in formal session.
One concern that was raised tonight, earlier today, was can the school committee act fast enough in order to do that? My response to that and what I'll share now is that there have been 2 times you guys have, the committee, has acted quickly to have a meeting. One was an emergency meeting and then one was this meeting. Both times they're about masks. Okay, so I've got full confidence that you folks can convene in a timely manner if necessary.
And when we did,
on
we
masks.
gave the 48-hour notice, because it was, we got information unknown.
It was an emergency meeting, right? That was masks essentially being taken off outside last year. Yeah.
So. Sorry,
Go ahead, Laura.
were you about to have one?
No, I'm not talking, I just mentioned it.
So I'm seeing in the MASC revised policy, this issue around students and staff returning from 5-day quarantine.
That's the last page. The last page in the packet is what MASC put out a couple days ago
Right,
as their revised, a sort of model policy.
right. So I fully understand that we cannot enforce that, but do we want to have language in ours that we we highly recommend and, expect? We can't enforce it. We understand that. But if we're looking at our data is very clear that everybody wants people to be masked for 5 days after they return. So how do we how can we include that, or can we in our policy?
That's just a recommendation.
You can make an amendment, make a motion to amend. If there's anything else in bold that you think should be, there might be a couple of those other ones that maybe should be mentioned in the policy, such as the bus. Yeah. And health officers.
Yeah, but it says we have to comply with other states, and if the bus changes, we're gonna have to come back and change it again, our policy again. It says we comply with federal laws, and that's the bus law, right?
Right, but it's clear here for parents to
Isn't
know
it
what
here?
the law is about buses. That's my point. It's not just buses, but it's not the law.
There's also the thing about health officers.
But what do you?
So.
I guess I need to
so,
get the
yeah.
language.
Is it okay, if I chime in?
Yeah, sure.
So Kathy's right that in the recommended policy that it says federal laws, that can be a communication issue rather than just putting the bus one in yours, because the bus one is very specific. Okay, so what I'm saying is, I don't think we need to put the bus one in there because it's too specific. And because we currently have a federal law and a federal order in place, we can message that.
Okay.
And we can, so I can act on that. I can support a message that we can follow it. You don't need to put that level of specificity into your policy. Right. And that allows your policy to survive longer, basically.
Yeah.
In terms of the health office, I'm assuming Jeff Parker would and nurses would support that. I haven't thought about whether that should be. I think that can be directed, administrative directive for me as well. I don't know. I think it's up to the committee whether they want to put that in there or not. I would say, in terms of the messaging around the first one, strongly recommending in this case, I think makes from the policy adds greater weight to it, or something that I think is actually very, very important. And we have seen that's the one in terms of looking at survey data as input. That was the one that was had the most agreement. I would say. I believe that's correct, right?
So I make a motion that we amend the suggested policy to include language that says students and staff returning from 5-day quarantine following a positive COVID test should follow strict mask use other than when eating, drinking, or outside, and conduct active monitoring for symptoms through day 10 of exposure.
Second.
Melissa?
Can I amend the policy instead of using the word should, say as recommended, because that's the language that's being used.
This says must.
Yeah, so she changed it to should instead of must.
It says must.
Strongly encouraged.
MASC's policy says must.
Okay, I'm not looking at MASC's policy, I'm looking at our policy. And I understand the language that you want to get in there, and I agree with it. I'm just trying to, I'm not arguing I'm just trying to think of the word only.
Or highly recommended.
Highly recommended.
Or strongly recommended to
follow. Yeah,
Okay.
instead of should.
I think strongly.
Yep.
So I'll amend it to say students and staff returning from 5-day quarantine following a positive COVID test are strongly recommended to follow strict mask use other than when eating, drinking, or outside, and conduct active monitoring for symptoms through day 10 of exposure.
Second. Okay, so we have a motion to amend.
I think she amended it on her own, so you don't need to do the amendment.
We're still amending the original motion, so, yeah, I think,
We are, okay.
I think Laura basically.
Well, I didn't get a second on my amendment, that's why. So when I said I wanted to amend, she went right back to her original motion. I don't believe there was a second on my motion to amend.
Maria,
I didn't know there was a motion. I didn't know you.
Yeah, it wasn't a motion. That's why I say that, Greg. She just changed it on her own without my
Right.
amendment getting
No, so
seconded.
she basically clarified her original amendment.
Yes,
So once we
exactly.
vote on this, we go back to my motion.
Yeah, vote, yes, yep.
Okay, yeah, so we have, so we now, Maria have the wording, yes? Maria, you have the wording? Okay, so
On the
we'll
amendment.
now vote on the amendment.
Laura's amendment, not mine.
Yeah.
Maybe state the proposal.
The amendment, to add-
the amendment, sorry.
The amendment would be to add in students and staff are trained for a 5-day quarantine following a positive COVID test. Strongly recommended to follow strict mask use other than when eating, drinking, or outside, and conduct active monitoring for symptoms through 10-day of exposure. Day test.
It's in our MASC, we got it.
Okay, Maria, we'll do a roll call vote.
Ms. Prince,
Yes.
Mayor Verga,
Yes.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
Chairperson Clancy,
Yes.
Mr. Melvin,
Yes.
and Mr. Minio.
Yes.
Okay, so the amendment is passed, 7-0. We're back to the original motion, which now includes this amendment. So any more discussion on that?
I have a procedure question. If I had a suggestion or a recommendation, a motion to change, can that follow this vote here?
Yes.
Oh.
Yeah, thank you.
Not before we accept the, it would have to be made before we accept the original
Right.
motion.
You'd have to say, I
If you're
want to
gonna
make
make
an
a
amendment.
motion to amend now, you would do it now.
That's what I was wondering, yeah, because I have questions about the wording. I don't understand, individuals who
This
remain
is the one we're
under.
working on.
Oh, okay, not this one?
Not that
But that's what we just amended.
Yeah.
Okay.
No, no, no,
Added that
we-
language to that.
We use this language as a guide.
Oh, I gotcha. So that's,
This is.
can somebody point to me where that is?
What are you looking for?
We essentially added it.
That one up here.
That's not in there.
Okay, thank you. That's, I don't need to make more.
That's okay. Okay, all right, so shall we vote on the motion? Maria, please.
Ms. Prince.
Yes.
Mayor Verga,
Yes.
Ms. Watson,
Yes.
Ms. Weason,
Yes.
Chairperson Clancy.
Yes.
Mr. Melvin,
Yes.
and Mr. Minio.
Yes.
Lost it.
I don't lose anybody, okay? What's going on about amendments?
Do we have any policy? Do we have a date?
Nobody cares about anything.
If you guys want to give the messaging, otherwise it's late and I don't know.
He's gonna write an email before he goes.
You can go if you want, or you can listen to me.
You don't
Oh my God, you guys could have
It's
gone.
not really.
No
I
offense.
got school tomorrow. All right, let me sort of wrap this up before we.
It's 10:30.
So, I'll say this, I'll say just a couple things, okay? If I-
Yeah.
Is, this is a really, really big deal. Okay, this is a great moment for our schools, for our community. I applaud the committee for making a thoughtful and reasonable decision. And it's, and you made that with a lot of good input from many, many people. And I think what that's going to allow us to do is folks to be able to continue to wear masks if they want to, and those who don't want to wear masks or families don't want to wear masks to take them off. That's going to have small impacts, like having the option of not wearing masks to meetings like this. Okay, that's a small impact.
I made the motion.
Then there's the big impact of walking through the hallways of Gloucester High and seeing a lot more smiling faces. And then there's the biggest impact perhaps of all, which is our kindergartners and first grade students for the first time will be able to see their classmates with full faces and the teacher full faces. And for those children, it's a gigantic deal. It's really important that, and this is not an easy thing to do, which is to help humans understand that someone who's making a different choice than they believe in is okay. Humans aren't always predisposed to do that. We have trouble with difference. So it is up to parents to help the children understand that. And it's also up to our staff. It's both and. And while I would have liked more time for our staff and our students to engage in those conversations, the committee's made a good decision. So we'll do our best with it. And I am urging, as I said earlier, students to speak up and to help each other understand their decisions and to look for understanding first as opposed to division. I'll ask our families to help their students understand, to seek understanding instead of look for division. And I'll direct our staff to have conversations in their classrooms to do just that. They do it very well, they understand about it, and we need to be clear about this one. We want everyone in our schools, whether it's masks or race or class or language, to know that for whoever they are and whatever they bring to our schools, they're accepted, they're welcome, and they're a part of everything, the fabric of our schools. And this is one way we can continue to do that. So it's a big, big deal. I'm really happy that those who choose to can take masks off, those who choose to can continue to wear them, and then we'll all work together on this great and very important phase we're entering into. So thank you to the committee, and go forward together.
Thank you. Very well. Okay. So.
We have some more
We have
part of the meeting.
we have some more
Yeah.
business that is not relevant to anything you probably want to know. TC voting for their field trip, but.
Thank you so much.
Thank you.
Thank you.
So you can recycle. Or you can phrase this is irrelevant.
Jeff.
Thank you, guys.
Oh, Jeff, thank you very much, Jeff, for being here.
These guys are.
And thank you, we have Gil, two
No,
people,
those two. Yeah,
two reporters from the Gil Matter here. Thank you for being here.
Thank you for having us.
Thank you.
Thank you, everyone.
Thank you,
Okay.
Jeff.
All right, so we have some action to take care of. The first order of action is the approval of the out-of-state field trip for the junior ROTC to Daytona Beach, Florida from Wednesday, April 13th to Sunday, April 17th, 2022.
So moved.
Passing out.
Oh, sorry, I didn't see that.
Mayor, I don't have the document I'm sharing, but I'll talk to the document I'm sharing about this. So this came forward a few meetings ago, maybe 2 meetings ago, to the committee. At that point, committee members expressed concern about traveling out of state. Most specifically was about if someone gets COVID, one of the students or chaperone gets COVID while they're away in Florida, what would happen? Let me back up to talk about the good parts of this. This is the JRTC program and students field trip to the National High School Drill Championship, which they qualified for. That's in Daytona Beach. And so since then, we worked with Master Sergeant Bose and to figure out some options, some protocols and procedures. They're on this page here. I'll summarize them for them. First of all, we'll have testing twice before they depart, and then testing also while they're there. Any student who is positive before they leave will have to stay behind, obviously. They had hoped to get 20 students. There are only 11, so instead of driving, they're flying, which makes travel quite a bit easier. Okay, in terms of really to COVID. Okay, rather than being in a van altogether or a small bus, they're traveling by air. That also makes so the other thing they changed was they added a chaperone and then a backup chaperone. They were only going to have one chaperone. And so if so we have 3 courses of action. If someone gets positive, they're listed here on your sheet. I'll just read them. I'll summarize them. First of all, one chaperone would stay back with an infected student or team members. They remain with them until they can travel safely, with negative tests. And then they would fly back. Okay, those costs would be incurred by the program's funds. That's one option. Another option would be that would be similar to course of action 1, but a parent or guardian would fly down. They'd have the option to fly down to take care of their child and then come back with them when they were safe to travel. In that case, the chaperones would go back, or the chaperone would go back when that family arrived. So they say, for example, that student needs to stay for 5 days. The family's coming down in 2 days. That chaperone would stay with the child until the family arrived. And then the last one would be sort of third scenario is if one of the chaperones got ill and came down with COVID, then the standby chaperone would fly down there and take over for them. That's what it is. So the only cost that would be incurred by a family is if they chose to fly down. They wouldn't have to, but if they wanted to, it's because that was their choice, then they would incur the cost for that travel. we would, we'll have a parent meeting prior to this happening, and we'll make sure that, and we'll have, and explain it all to the parents and families, and they'll have to sign a statement of understanding so they're aware, so they just sign off that they're aware of both the testing protocols and agree to them, and then also, to, understand what might happen if their student, who can't, had a positive test.
We'll put the work into this.
It was a combination of Master Sergeant, he did the graphic, it wasn't me.
Don't mean the graphic.
Principal Cook and myself.
Okay.
Yeah.
It's really comprehensive and helpful. Thank you so much for
Yeah, you're
taking
welcome.
the time to clarify that for us.
We tried to be comprehensive and helpful.
Okay, so do we have a motion to approve the JROTC trip to Daytona, Florida?
So moved.
Second.
Discussion. Good for them. Maria, roll call vote, please.
Ms. Prince,
Yes.
Mayor Verda,
Yes.
Watson,
Yes.
Ms. Weason. Yes. Chairperson Clancy.
Yes.
Mr. Melvin.
Yes.
And Mr. Minio.
Yes.
Passes. No, we have two more, we have three more pieces, items of business. Right?
We have contracts, well, salary increases, not contract.
We have, so we have the approval of the ASME memorandum of agreement effective July 1, 2021 to June 30th, 2024. Right?
It was approved in executive session.
It was approved in executive session
Last meeting.
last meeting. So do we have a motion to approve the contract?
So moved.
Second. Discussion? Okay.
I would just ask that for the terms to be posted, whether the contract will be posted on the website, I'm assuming with other contracts and public can see
Yes.
the language of that agreement.
Yes, and Stephanie's been working on getting make sure all the MOUs are incorporated into the contract and getting them posted. Maria?
Ms. Prince.
Yes.
Mayor Verda,
Yes.
Ms. Watson,
Yes.
Ms. Weason.
Yes.
Chairperson Clancy,
Yes.
Mr. Melvin,
Yes.
and Mr. Minio.
Yes.
Okay. Sure. Okay, next item of business is the approval of the new supervisor's memorandum. Well,
I'm gonna make a motion that we increase the new supervisor's salary as was discussed in executive session and approved in executive session last week. And add in the holiday Juneteenth.
second.
So just to be clear, there's no representation for this group. So we're not in contract with them. So we're not approving a contract, but we did utilize our management rights to increase their salary and give them an extra holiday. So we're out of contract with them still. However, their salary increase and that holiday will be effective as soon as we approve it.
Any discussion?
Oh, did you get a second?
Yes.
Yeah.
Yes.
Yeah.
Go ahead, Maria.
Ms. Prince,
Yes.
Mayor Verda,
Yes.
Ms. Watson,
Yes.
Ms. Weason.
Yes.
Chairperson Clancy.
Yes.
Mr. Melvin,
Yes.
Mr. Minio.
Yes.
Okay, and we have one more item of business, final item, approval of crossing guards, effective July 1, 2021 to June 30th, 2023.
So again, we do not have a representation from crossing guards. I believe we only have 2 crossing guards at this time. But as we discussed and approved in executive session last week to raise their salary and add the holiday. So the motion is to approve the increase in pay and the addition of the Juneteenth holiday for our crossing guards effective July 1st, 2021.
Discussion? Seeing none, we'll go to Maria, roll call vote.
Ms. Prince,
Yes.
Mayor Verda,
Yes.
Ms. Watson,
Yes.
Ms. Weason.
Yes.
Chairperson Clancy.
Yes.
Mr. Melvin,
Yes.
and Mr. Minio.
Yes.
Okay, that passes unanimously. That is the last item of business for this evening. Motion to adjourn?
Second.
Okay.
Ms. Prince,
Yes.
Mayor Verda,
Yes.
Ms. Watson,
Yes.
Ms. Weason.
Yes.
Mr. Clancy,
Yes.
Mr. Melvin,
Yes.
and Mr. Minio.
Yes.
Thank you, everybody, who hung in here with us for a long meeting. Good night, and Enjoy the school day.